A circle. Okay, got it. You've got a bigger circle there. That bigger circle represent the population, and the smaller circle there will be the sample, and hope that that sample represents the bigger population. Right. Now, what are the key definitions before we go deeper into the subject of sampling and sample size? I just had a workshop, I think a week or 2 weeks ago, on sample size determination, and I will have a follow-up of that workshop at the end of this month, I think around about the 26th. I think for postgraduate to be a good opportunity to, because then I'll be going to the finer detail of determination of sample size and how you approach sample size and the reasoning that you need to have to arrive at a robust and reliable sample size. So some definitions here: population, and I've also said here it's a universe. Covering is the collection of things and the consideration. I've given all the people that smoke in PE. That would be a population. And therefore, a sample could be, perhaps let's look at go and put the stations at somewhere in the middle of the city in PE and get 50 people. And those people, therefore, we hope that will represent all the smoking people of PE. We get 50 around the city center in PE and look at their smoking habits and hope that the 50 we got in PE, that's a sample, in the middle of the city, will represent everybody in the universe, or the population of smokers in PE. I think you get my drift there. So the population and the sample and the parameter. This is important to emphasize because I see this every time with my students coming in, can be confusing, and I try and make it not confusing. If we can get it here, I think it will be easy in future. A difference between a parameter and a statistic. A parameter, therefore, is a summary measure or number calculated or computed to describe a characteristic or property of a population. The key word here is population. So it's the number or summary measure that describes a population. Parameter describes a population, and the statistic is a number or summary measure that describes a characteristic of a sample. Statistic describes characteristic of sample. I've given an example here that if we look at the parameter here, say the median income of the local town of Dispatch in the Nelson Mandela Bay Area. Median income or average income, if you want, if that's what you're interested in, but of individuals in Dispatch. But the statistic, median income of a sample of 50 people that we got in Dispatch. So a sample we sampled a few people in Dispatch, we got 50 of them. We asked them, you live in Dispatch? Say, yes, indeed. And we look at the median income of those 50 and hope that these 50, now there are issues there, but we'll deal with those issues. These 50 represent the people, all the people of Dispatch that have an income. So please, let's keep in mind the difference between a parameter and the statistic, and let's be clear about the two when we report. So these are key definitions I want us to pay attention to as we move into this: a population, a sample, a parameter, and the statistic. I've just mentioned census. A survey, census, I've just said, is a survey in which information is gathered about all members of a population. I've given you a nice picture here. So census is everybody in dispatch, and then a sample will be a number of people that we met in the street, in the main street of dispatch. We selected a number of people there. That is a sample, but census is everybody. But it can be anything. Make this practical to your own research. It could be, I want to understand diabetic patients. So DM, students, all the diabetic patients that visit what do you call Doranginza Hospital, since students doing studies like that. All the patients that visit Doranginza Hospital, diabetic patient, that's your population. And then the sample is those that you will you go there on a Thursday, on a Friday, you identify say 20 of them, and hope that those 20 that you have seen diabetic patients coming to see their doctors represent all the diabetic patients in that visit that particular institution. Think about it. So a census vis-a-vis a sample. Now, sampling concepts. Just worried that at the top there, I want to take out that by the top because writing maybe is clear, but sampling concepts. Now, population or target population, sampling unit, and sampling frame. Again, I'm going to move slow here because sometimes it can be a tongue twister. And I'll try and unpack this in a very easy way to understand. Sampling unit, sampling frame, target population. What are the differences between these? Now, we've seen a target population is the collection of all individuals or families or groups of organizations or events that we're interested in finding out information about or researching about. And therefore, this is the population to which the researcher would like to generalize research. In the previous example, I said all adults in dispatch, the small town of Nelson Mandela Bay. So my target population is all adults of dispatch. But my sample, therefore, would be those that I perhaps meet in that main street, and perhaps I've got 100 of them, and hope that they will give me information about because I'm interested in adults of dispatch. But I have 100 adults that I met in the street, and I've collected data on them, and therefore, hopefully, they will give me more information. So that is the target population. And now the sampling unit is the building block of a data set. And I want to unpack this. And I'll repeat this. The sampling unit is the building block of your data set. And these are members of the population from which measurements are taken or are going to be taken during sampling. I'll give you a practical example. Now, a student is interested in studying Nelson Mandela University students with respect to what they do on a Friday after a long week's work, a Friday evening. So you're looking at Nelson Mandela University students. So you got a big number of Nelson Mandela University students. Now, therefore, it means one university student is your sampling unit, is the building block. The target is Nelson Mandela University students. Your sampling unit is one university student. I'm hoping I'm making sense now. And then let's say also I've seen some students coming to me saying, I want to look at households around PE. For instance, in a township called Zwide in PE, in Nelson Mandela Bay. I want to look at household income, if that's what you're interested in, at Zwide. but I'm looking at households. Now, the key word is I'm looking at household. Therefore, it means one household represent my sampling unit. It's a building block because I'm looking at households at reader. One household is my sampling unit. I would like to just for a second there, Doc. I'm still very clear. You're not picking up any questions so far, ma'am. So far, so good.
Let's check first, Doctor. Are there any questions from the floor and online? Any questions? No, we're still good. Doctor, you can go on.
We're still good. Thank you, ma'am. Thank you. Now, sampling unit. We looked at target population, your sampling unit. So your sampling unit talks to your target population, and we've seen it. Now, what is then a sampling frame? Sampling frame is the actual list of these units from which the sample is taken. Come to think of it. In terms of students at Nelson Mandela University, sampling unit is one student. So sampling frame is actually number of these students that we will sample from. So in other words, I'm saying, note that the population contains all members of the group. Sampling frame contains those members from which we can sample from, or we can draw the sample from. I hope that is clear. I want to emphasize that again. Population contains all the members of a group. Let's go back to smoking habits in PE. Sorry for that example. But now that is our target population in PE. But we're going to sit somewhere in the middle of the city in PE. And within that city now, we will then sample. So it means we're sampling within that area in the city center. So our sampling frame is within the city center, and hope that the number of people there in the city center is our sampling frame, is where we'll sample from. But the bigger population is the people of PE. Now, another example here is the target population, Nelson Mandela University. Your sample frame, because I'm interested in looking at my target population is the university students at Nelson Mandela University. But I'm interested in looking at health science students. But I'm not going to access all the health science students. I will sample from health science students. So target Nelson Mandela student, Nelson Mandela University student. But I want to look at health science students. So that's my sampling frame, is where I will sample from. But because perhaps I don't have all the resources and time to include everybody within the Faculty of Health, then I will sample from that Faculty of Health. I hope it makes sense, but if it doesn't, I've got my email here. Feel free to contact me again and let's discuss this. Oftentimes there is confusion between target population, sampling frame, and the sampling unit. And feel free to drop me an email and I will explain this, or let's set an appointment and discuss it. But I think I've given a very good example. If you want, I can go over that again. I'm doing a study on university students, Nelson Mandela University students. That is my target. I'm targeting Nelson Mandela University students in terms of their recreational activities. But I want to look at the health science students. So I'm going to health science students, but I can't cover all the health science students. I will sample from health science. So health science students is the sampling frame. I'm sampling from health science students, but the bigger target population, Nelson Mandela University students. I hope that makes sense. Now, sample design is a set of rules, as I said in the introduction, research design, design of experiment, things like that. Sample design is a set of rules and procedures that you have specified as to how you will collect your sample. And this can either be I will go into detail in terms of this, but you can either come from what we call a probability or non-probability sampling. The probability being more a random sampling as opposed to the other one, but we'll discuss this. So you have two legs now. You can either approach your sampling from a probability point of view or non-probability approach, but we'll discuss that. So it's sampling design. How are you going to conduct your sampling? And the sample size, therefore, is the number of those elements in the sample that you've obtained. I'm looking at Nelson Mandela students, but I went to the Faculty of Health Science, and out of the Faculty of Health Science, I got 50. That's my sample out of Faculty of Health Science students. Perhaps the whole faculty has got, argument's sake, 3,000 students, but I got 50. That's my sample. Now, types of sampling, I've just mentioned it here in the design of sampling. There are two, as I've just said: probability sampling, probability, let's remember this, probability or random, and what we call non-probability sampling or non-random. Those two, and we'll go more into detail in terms of these two. I've got a diagram for you here. Probability sampling, we will cover simple random sampling. I think some of you have heard about this. We will cover systematic sampling. We will look at what we call stratified sampling and also cluster sampling. And under non-probability, we'll look at convenience, purposive sampling, snowball sampling, and quarter sampling. I hope our time will allow us, because I think we've got an hour here. I don't have a clock in front of me, but that's fine. So probability sampling now, I kept the diagram there for you. This is sampling in which each individual in the population has a chance of being selected. Each individual stands a chance of being selected. That's what we mean probability sampling. And we've just stated the different types of probability sampling approaches: simple, random, systematic, stratified, and cluster. Please remember these, because masters, PhDs, postdoc, you start your project, you want to sample, you need to know exactly the type of sampling approach that you will use. Are you going to go with the simple random? Are you going with the systematic sampling? Are you going to go with stratified or cluster? But there must be a rationale to that. So I'm going to go more in detail into each one of these and the reasons for using that particular sampling procedure. But we are under probability sampling now, random sampling. Now, simple random sampling, and we've seen that. I put just for you multi-stage, but we'll leave this multi-stage for now. I will talk about it later. Now, let's look at simple random sampling. Simple random sampling, every individual or item from a frame, we now know what a sample frame is, has an equal chance of being selected. That is key. That is the defining feature of simple random sampling. Each individual from the sampling frame has an equal chance of being selected. But selection may be with replacement or without replacement. But what are the implications if selection has replacement? In other words, an individual can therefore be selected more than once. Come to think of it, let's give a practical example. You're looking at your students. You got a class I've got a class of biostats students, second years, there are 20 of them in my class. I want to conduct a study. So I'm sampling for my 20 students. So I'm doing a random sampling. So I write all their names, I write all your names on small pieces of paper, and I roll those papers into tiny, into small bowls, paper bowls, and throw them into a glass jar and shake the glass jar. It's got 20 of my students in there. And I blindfold a friend, and he dips his hands into that glass jar. I pick one, and that's John. So I write, John has been picked. John is in the study. But now that means I'm left in the jar with 19. But if it's with replacement, it means that I take back John's name and throw it back into the jar and shake again. Believe you me, it's possible to also pick John for the second time. So there are merits to that, but there are also disadvantages to that. But we'll discuss that perhaps towards the end of this. So an individual can be selected more than once. So a selection with replacement or selection without replacement. Think about that biostats class of mine. I check, pick John. John is been selected. John is not in the pot anymore. I've got 19 left. I check. Next, I pick Mary. And Mary cannot be picked again. John cannot be picked again. So it's without replacement. So an individual can only be selected. Try and read about this. What are the advantages of selection with replacement? Is it applicable in your case, in your project? Why would it be? Or selection without replacement? Samples obtained from a tape of random numbers or computer-generated random numbers. I think you have seen this before. You can generate random numbers in a computer, and those numbers then can be used for your simple random sampling. I sometimes use that with my students. We use random numbers and also random samples. I think it's important to note this, that random samples are unbiased and on average touch wood representative of the population. So the random sample, think about my biostats second year class with the names in a pot or in a jar, checking that. Hopefully the paper bowls are equal size. There is no bias in terms of size, and the colors are the same. But then the person who's picking is blindfolded. So that ideally this random sampling is supposed to be unbiased and therefore a good representative of the population. Keep that in. Let's remember that simple random sample. Now, what is a systematic sample? The second probability sampling approach. This method is indicating here is referred to as systematic sample with a random start. I'll explain this. Systematic. And I've got a good example of a student that came to me and we decided to go with this one. I'll give you an example. The student is looking at households in a township in PE. So the township is got houses in, organized in straight lines, following streets that picture this in straight lines. So he wants to sample household incomes. So what he does in systematic sampling is you got to look at the first line and you randomly pick the first house. Can be the first house, second house, or third house, doesn't matter, but randomly pick the first house. And then after that, it's up to you, knowing the total number of houses that are in that area, you can then pick, say, every third, systematic, every third house from the one that is a start house. So the start house will always be random. It can be the first house, corner house, second house, third house. You can randomly pick the first one. And after that, you are systematic. I want to take every fifth house or every 10th house, but consistently use that interval. So it's a consistent interval, every fifth house or every 10th house or every third house. That's systematic sampling. So we've covered random, simple random sampling, and systematic sampling. This is systematic sampling, and I've given you a picture here. You can have people in a queue like that. You want to ask them questions, maybe picture these long queues at a bank. You want to ask people about the services that you get from this particular bank. So you got a very long queue. Now you can't ask everybody, but you want to use systematic sampling. So you can probably say, I'll pick the guy closest to the door, and then after that, I will skip, I will take every third individual in the queue as they go into the bank and ask them about how what they feel about the service that they get from that particular bank. So that's systematic sampling. Please, let's remember systematic sampling is a probability sampling and how it's done. And think about your project. Would it be a proper sampling procedure, and why is it? Let's discuss it. Now, I've given you other examples. Just say, randomly select one individual from the first group or one house, randomly select the first house, and after that, every eighth house. Think about it, or the fifth, or the third, or the 10th house, and so forth. Now, looking at, I've got the picture right there at the top. We've looked at simple random, systematic, and now we're looking at stratified random sampling. So I want to explain this. Random, stratified random sampling. This involves dividing a population. Now, this is key, because I see this one oftentimes used interchangeably with cluster. So I want to explain stratified. Stratified random sampling. You divide your population into distinct subgroups based on the characteristics, important characteristics in those individuals, such as age, such as socioeconomic status, such as religion. I want to give you so in other words, population is divided into two or more groups according to some common characteristic. And then simple random sample selected from each. Let me explain this. You wanting to look at how boys and girls deal with work pressure, homework pressure after on weekends. That's your question. That's your research project. Is there a difference between how boys and girls of Nelson Mandela University deal with assignments over the weekend? It's a question. It's your research project. Therefore, you might not have the same number of boys and girls. So it might help to then say, let me separate boys and girls and sample from individual group from boys and girls. Therefore, you then sample from the boys. How many boys must I have? Take into account how many in total you have, and then you sample from the girls, take into account the total number of girls. So you are sensitive to what you have. And also you could then say, I'm looking at socio-economic levels. I'm looking at religion, but I would like to sample from each one of the religious groups, and therefore you're going to then group your target population into those groups, and then you sample from those particular groups and so forth. And so I hope that makes sense. So you divide your population based on a distinct characteristic a common characteristic that is had. And then you sample out of each of those distinct groups, you have subgroups that you have created, cognizant of the total numbers that are available to you for the subgroups that you've created. Now, the two or more samples are combined. Therefore, the sample of boys that I've selected for Nelson Mandela University and that of girls, I then combine those. I've got the total number of students that I need to look at how they deal with their assignments over the weekends. Stratified, divide the group based on a common characteristic or a distinguishing characteristic of that. And then you sample from those groups that you've created. That's stratified. You sample then randomly from each one of those groups you've created. Cluster.
Dr. Sibanda, sorry,
yes.
I just want to alert you to your time.
Yes, Doc.
Yeah, so you have about 5 minutes left, but I'm going to give a little extra because we started a little bit late, but just to alert you to that time.
That's fine, ma'am. How many more minutes? Yeah, let me just...
So I'm going to give you 5 minutes, but we can go a little bit over that, and then we just want to make sure that we give students an opportunity for questions, please.
That's fine, ma'am. Like I said, that's fine. I'm looking at, say, we get to, would it be all right if we get to 10, what do you call it, 9:40? Would that be fine?
Sure, that's fine. Thanks.
9:40, ma'am. Okay. Now, let's see what we covered up to that point. So, cluster, think about geographical location sometimes. In other words, spatial location in cluster, think about spatial location of your target population. I'll give you an example here. You divide now your population based on its distribution. I gave you an example here. You want to look at how patients access services in tertiary. You should remember in this country, hospitals are put into different levels. So you got tertiary, secondary. I think we all know that, then primary, and then clinics and things like that. So tertiary hospitals. I want to look at how people access services at tertiary hospitals in South Africa. Now, South Africa is a huge thing. I'm sitting here, Nelson Mandela Bay, at Nelson Mandela University, in a very at the far corner of the country, but I want to understand how services are rendered to patients in tertiary hospitals in the country. So what do? I then divide the country into the 9 provinces, because I know there are 9 provinces. That is not debatable. And I know I've got 9 provinces, and that makes it manageable for me. But then, remember what I did with my students, biostat students, where I put their names and I rolled that into bold, and I was checking, and I take those provinces, I put them in a pot, in a jug, and I roll them. I call my friend, my best friend, blindfold him, and he picks. And the first one that he picks, I hope you don't take me to task with this. The first one that he picks is Limpopo. And then he picks again, he picks KZN, he picks again, he picks Northwest. And therefore, the ones that I've picked, I'm hoping we'll discuss why you're picking 3, but the reality of it is I'm sampling out of these clusters. So I'm sampling now out of these 9, I'm going to look at that these 3, Limpopo, KZN, and NW, Northwest, and hope that the information I get from these 3 will give me an insight into how services are accessed in tertiary hospitals in South Africa. Therefore, I'm sampling clusters. Out of the 9 clusters, 9 provinces, I have 9. But now, the key thing here is the 3 that I've sampled, I will then include all the tertiary hospitals in these clusters. I do census, I do include all of them. And that is the important thing. Then I look at all the hospitals, KZN, Albert Lutuli maybe, and then King Edward, and then in Northwest, maybe there's something else, and then Popo, there's something else. So I take all the tertiary hospitals because I know my inclusion-exclusion criteria. So I know a good definition of a tertiary. I've identified the clusters through a random process, and therefore in those clusters, I'm going to include all the entities that meet my minimum inclusion criteria. In this case, tertiary hospitals. I hope that is clear. Distinction between stratified and cluster. Stratified and cluster is very important. And I just noted here for you that this method is typically used when the population is large, widely dispersed and inaccessible. Think about all the 9 provinces, and we are sitting right at the corner of the country in Gqeberha, and we're wanting to understand how services are rendered in tertiary hospitals right across the country. Now, non-probability, Doc, I don't want to this is an appetizer, Doc. So I don't think it would be a fast stretch to say we'll do justice to everything to do with sampling, but is to give an insight, if you of how sampling is done. I would love to get into non-probability, but I'm cognizant of time also. We have 2 minutes in that extra time you gave me, Doc. Like I say, it's an appetizer of this, but perhaps we can have follow-ups on this. I know that the next session deals with data collection, and I think perhaps then we can see what we can do now, Doc. I think I can go into convenience, but I'll have to really be skimpy on this. I don't know what your take is, or must we keep it at this?
I think let's pause there. I think what's important is to at least have the probability sampling covered. And then I know Dr. Sibanda, he does offer workshops as well. And I think there was one recently that our faculty also arranged for students. So I think maybe let's pause there. There's a lot of information to process as well. So we want to just check that where the students are having any questions, any comments, thoughts is going through your mind in terms of what has been covered. Perhaps a good question might be for Dr. Sibanda to recommend some good books that you could, some good literature that's recent that you could consult around both probability and non-probability sampling, perhaps. So let's just check in. On the floor, see if the mind's working. Registering all the information. And then online, any questions? Nothing? Okay. Okay, so it's Dr. Sibanda. Oh, there's a question there. Okay. I don't think we have a date yet for the next workshop with Dr. Sibanda, but I think Berthland normally does send out if there are any upcoming workshops. So please keep a lookout for that. And then normally we also encourage the supervisors as well, your supervisor, to check in. So do try to attend that workshop. And then perhaps Dr. Sibanda, for your presentation, which will be available, you know, the last slide to have references there, that might also be a good starting point to consult those references.
Sure, absolutely.
Right.
Absolutely.
Thanks. We see there's a hand. You can unmute and go ahead.
Good morning, everyone.
Good morning.
Let me appreciate Dr. Sibanda for explaining these differences very well. I hear a noise.
Yes, there is background noise. We can hear background noise indeed.
Okay, I think it's started right now. Okay, thank you so much. Dr. Subanda, you have presented very well. Everything is clear. However, in my case, I think I was like having a problem in confusing one of these strategies like purposive and what else? Oh, let me check here. There was a bit of confusion
Yes,
between purposive and systematic. So I would like you to like explain in a very simple terms because of time.
yes, sir.
The distinction between the purposive and the system. You have touched more of the systematic, but purposive as well. I want to have some bit of explanation there, just in simple words. Thank you.
Sure. Your name again, sir? Sorry.
Mfundelwa Wilbert. We're sharing the name, Wilbert.
Oh, my namesake, Fundelo. Right. Let's Fundelo, you absolutely right. I get the question, but then yes, purposive and I think you say systematic.
Systematic, yes.
Yes, but usually we don't want to confuse those two because those belong to two crops. You know, they belong to two folds.
Yes.
One is not random, the other one is random. But I'll start there. Systematic is a random process, isn't it? But while purposive is non-random, but I will explain more now. You will see the distinction between the two. But keep in mind that systematic is a random sampling process, while purposive is not. But where I always see Mfundelo misunderstanding is between purposive and convenience, but that's fine. Let's quickly look at purposive from what I wrote here for you. You see, when you purposive is intentionally selecting your participants based on a characteristic, knowledge, experience. You select them on that. In other words, you are doing a study on a particular subject, and you go
Yes.
to specific individuals that have that characteristic you're looking for. So I think you can see some people say there's an element of bias here. Isn't there? There's a judgment now. You can make a good judgment in that. You might not make a very good judgment. We sometimes call purposive a judgment sampling, isn't it? So you're going to individuals that you know have the characteristic that you're looking for. So you purposively go to those people.
Okay.
So it's based on the knowledge. So you're selecting a sample based on the knowledge of your knowledge of the research problem. And therefore, it all hinges on your expert judgment. And once you say that, then you're opening a can of worms now, a Pandora's box, because some people might question that expert judgment. You understand, some people might say there's an element of bias now. It's not random anymore, but you're going to specific individual because in your understanding, those individuals will give you the data that you require.
Okay. Maybe if we can make an example, maybe we can talk about maybe you identify nurses as your sample in this regard, only nurses,
right,
in the hospital. Am I
exactly.
right?
Yes.
Okay. Thank you so much for that, Doc.
And we usually prefer that for exploratory work or pre-testing a questionnaire because it's got those issues of bias and Fundelo, all right? So the fact that you're making the judgment yourself, you're not randomizing. Come to think of it, I want to understand something about nurses in a given hospital or institution. I might put them all in a hat, remember that hat or that jug, and check their names and randomly pick the names and then go to the names that I've picked. You see, that is random, say. But if I the flip side of that would be, I know NES X, and I will give me information on this, and I know NES Y. You see, it's my judgment.
Yes.
I'm not randomizing anymore, but I'm going to specific individual, because from my knowledge, they will give me the data that I will complete my study. Does it make sense, sir?
Yes, it's more than clear, sir.
Yes, so it's a judgment error, as opposed to, think about the purposive, for instance. Purposive, fundamental, therefore, is getting those that are convenient to you.
Yes.
I'm doing a study in a small town in Mthatha, around say a dumping area, right? But I'm asking people about what are the issues that you get from this dumping site, right? Municipality. So, but I'm asking those that are just next to me. It's convenient. You understand? So I'm asking people around me. I'm not randomizing. So it's convenient. I'm asking those that are next to me. They're convenient to get. And I've not applied my mind in terms of whether they can give me the information that I require. So I want you to read a little bit about the distinction between purposive, convenient, systematic is a random. It's a random process. It's in a different basket altogether. But systematic, purposive and convenient sampling. All right, sir.
All right. It's quite clear, sir.
Okay, then.
I really appreciate it.
It's a pleasure. It's a pleasure. Doc, are we still good? I think we have gone way past our time. You picking any other question, ma'am? Okay. Am I muted here? Okay. Right. I think we can leave it at this for now, for this session on sample size, sampling. I think I can give back the floor to the chair. I can't hear this side. Is Doc still around? Good.
Your questions, I'm sure Dr. Sibanda would not mind later on responding when we have tea. And then also for yourselves as well, reading on what Dr. Sibanda has spoken about, that would obviously be your next step. Dr. Sibanda, you are now again on the floor for data collection. You are welcome to proceed.
Okay, ma'am. I thought you were going to give them a smoke break. There is no smoke break.
Now, do you need a stretch break? Do you need a stretch break? Let's check.
I'm fine this side, Doc. I don't know if they...
No, they're good.
They're good.
They're eager. Thanks.
Okay. Thanks, Doc. I think we got, 30 minutes. I'm trying to look at my timetable here. You'll be our timekeeper again, ma'am. Sorry for that.
Yeah, I'm the timekeeper. So for now, you will have until 10 o'clock. So you have to manage your time a little bit. We can go a little bit to 5 past, but no further than that, please. Thanks.
Okay. Right, there we go. Now, again, it's really, like I said, Doc, it's I want to get students excited about these things. It's an appetizer, and just giving them an idea on data collection, but really we can't do justice to this. I'll just perhaps go through just a few slides on this, and then the rest we will meet and discuss. And they can make appointment, or we can have proper workshops and seminars on this thing. Now I'm projecting again this one here. Share data collection method. Doc, is it visible on your side?
Yeah, we can see, and just in slideshows.
Okay, Doc.
There we go.
Now data collection methods. Again here, what are we looking at? We all know what is data, and I'm just saying here, data set of values of qualitative or quantitative nature, variables about one group or one or more individuals or objects. So that is what data is. And data simply units of information. So I want just starting off with an overview of what data is. Data are measured, collected, reported, analyzed, and used to create data visualization. And that is important. Data, how we measure data, how we collect data, how we report, analyze, and use it to create data visualization, graphs and tables. Now, there's a saying here, you can have data without information, but you cannot have information without data. Very interesting. I think we all understand what that means. Information is, in other words, data is a low level knowledge. Information is a higher level entity. I think we all understand. So without data, you can have data without information, but you cannot have information without data. Information can only be obtained from data. Think about that. And then quantitative data. Here I'm looking at numerical data. Data refers to measurable observations, and I'm saying quantitative based on numbers and things like that. And examples I've given you: the weight of sumo wrestlers, the duration of red lights, and so forth and so forth. That's quantitative data. It's based on numbers. I'm just going to quickly move through this. Like I'm saying, we need to have a fully fledged workshop on this. And qualitative data then looks at categories. Is data that can be arranged into categories based on physical traits, gender, color, anything that does not have a number associated with happiness, rating, like very happy, happy, and not very happy. Gender, male, female, eye color, blue, red, green, and so forth and so forth. Think about
Dr.
quality.
Sibanda, sorry, there's
Yes.
a request to put the presentation on slideshow. I think it might be small for those online.
Okay, all right, ma'am. All right.
Please, there we
Is
go.
it up
Great.
now, though?
Yeah, perfect. Thank you.
Okay. Now, qualitative data. Now, what is data collection? I'm also looking at my clock here. Data collection, it is the process by which the researcher collects information. And in this case, you, the postdoc, the postgraduate, how you collect your information needed to answer the research question or the research problem. The task of data collection begins after the research problem has been identified. I always say this, properly defined. I always say this to my students, that first things first, understand the question very well, what you're seeking to do before you collect the data. So your data then talks to the question that you have. And these are the different methods of collecting data. We'll talk about observation, questionnaires, interviews, and focus group. I think this discussion, we're going to have to put it on ice. I'll just highlight this quickly, but I would love to go in detail on this one here some other time. In collecting data, the researcher must then decide which data to collect, how to collect the data, who will collect the data, when to collect that data. Very important question. And then the purpose of data collection is to obtain information. Remember I said, you can have data with no information, but you cannot have information without data. Therefore, we get data so that we get information, and to keep a record and to make decisions about important issues. Maybe you want to make recommendations. You are a healthcare worker to the municipality in terms of water quality in your area. So you make decisions about important, or to pass information to others, to inform others through, say, maybe a publication or a workshop or a conference, or whatever means you want to use for passing on information. Methods of data collection, essentially we have two: primary data collection and secondary data collection. Primary data collection These are when you collect data yourself. First time, collect data. In other words, you're collecting data for the first time. And secondary data collection is you using data that's already collected. Secondary, I've done a lot of work with my postgrad students, medical students, MEDs and things. They always come with secondary data in a hospital, in KZN, a hospital in Mpumalanga, in Gauteng, in the Western Cape. They're going to the clinic, they get what we call case files, and this is what secondary data is, data that is stored. Or if you are a health practitioner, maybe it's data in the municipality repository with respect to your subject matter. So it's stored data. But primary data you collect for the first time. So you design your study and you go out and collect data. Please keep that distinction clear. Are you going to use primary data in your project? And what are the advantages and disadvantages? Or are you going to use secondary data? And what are the pros and cons of secondary data? Now, primary data vis-a-vis secondary data. Primary data you collect real time. So you design your study, you go to Umtata, or you go to Kunu or to Kumbu. You collect data there yourself in a small community about whatever subject you are interested in. So you're out there in the field yourself collecting data. You're sure about the source. You are sure about the source where you can answer the research question and the cost and time. Think about cost and time in terms of primary data and can avoid bias because you are there yourself collecting data and more flexible sometimes. But secondary data is past data. We sometimes call it old data. You're not sure about the sources. You have an idea. It was collected at Albert Lutuli in Durban, but it's been collected by other doctors. But you want to come and do your master's now, so you get your master's. So you're using that data that's in the files, but you might not be sure how it was collected. But it's there. It's in the hospital, and it's sometimes cheap, oftentimes cheap to do because you don't have to go out to the field yourself to collect the data, and bias cannot be ruled out because you have no control over how this data was collected. And I see this all the time with my MEDs. They come with the data from the clinic. Now we discover even some of the data was not corrected right. Some of the doctors did not really apply their minds in the collection of the data, and therefore you got to deal with the issues with the data. So there's pros and cons to that data vis-a-vis yourself collecting the data. Now, methods of collecting primary data is observation, surveys, interviews, questionnaires, and schedules. There's a ways of collecting primary data. Please, let's remember this. I will not go deep into this. Like I said, it's an appetizer. We almost make bang at 10 o'clock. So it's observation, surveys, interviews, questionnaires. Please remember this one here. And schedules and observation method is a method under which data from the field is collected with the help of observation by the observer or by personally going to the field. So you observe. So I'm just going to run through this in the interest of time. So the steps for effective observation, you determine what you need to observe. You select the participant. It can be random, whichever way, and you conduct then the observation. But in conducting observation, think about the venue, the duration, the recording materials, and things like if you're going to take photographs, and then how you're going to compile that data, and then you analyze it. These are the different steps that you need to take into account in an observation. You can have different types of observation. You can have a structured observation where the observation is characterized by careful definition of units to be observed, predefined units to be observed in terms of style of recording the observed information, standardized conditions of observation, and the selection of related data for observation. That is structured, predefined. But you can also have an unstructured observation when it takes place without all the above that I've stated, not predefined. Let's just remember this, engage, drop me an email, make a booking, let's discuss this. Should I go with structured or why? An unstructured observation and why again. And then again here, I need to, then Doc, I'm really, now I know I must put it on project, but like that. Let's do this. Is it going to help me? Right. Now, participant observation, when the observer is a member of the group which is observing participants. So you are, as a you are participant observing, or you are non-participant observing when the observer is not the member of the group which is observing. Then it is non-participant observing. The observer is observing people without giving any information to them. That is called non-participant observation. You can also have uncontrolled observation when observation takes place in a natural condition. Think about it. Uncontrolled, it is done to get spontaneous picture of life and person. Think about what National Geographic does in a safari area in Kenya, where they put a camera and leave the camera there, and they look at how the animals come to the watering point. And control observation, or control when the observation takes place according to pre-arranged plans with experimental procedure. Then it is controlled observation, say in a laboratory. Advantages of observation: large quantities of data produced. All data obtained from observations are usable, and the observation technique can be stopped or started at any point, and relatively inexpensive. These are the advantages of observation. I'm sorry for this. I'm just flying through this. I'm pushing for 5 past, just a few more minutes, but we only looked at observation, and disadvantages of observation would be interviewing selected subjects may provide more information, might be economically better option than waiting for the spontaneous occurrence of a situation. Think about it. And you might need extensive training in order to conduct observation and things like that. These will be the disadvantages of observation. Again, we have surveys. Doc, again, given this time, I think it's suffice to say perhaps what I will do is I will send our students this PowerPoint presentation, then they can engage with this rather than trying to pack it all here. I've got almost 40 slides on this particular presentation. I don't think it will be wise. But I've just stated here the different types of data collection approaches and the surveys. Let's go back to that one here. Right here, this one here: observation, surveys, interviews, questionnaires, and schedules. But I'll send you slides on observation. We just covered observation. I'll send you slides on surveys and how surveys are done, advantages of surveys, and I'll send slides on interviews. When do you do interviews? What are the advantages of interviews? And then questionnaires. When do we use questionnaires? What are the advantages and disadvantages of questionnaires? And I'll also send you information on schedules. These are the different methods of collecting primary data. I think, Doctor, I will leave it at that, considering your time is almost 5 minutes past 10 now.
Okay, thank you so very much, Dr. Sabanda, and thank you for at least introducing them to the different types. And I think there was a request again from the chat that please, if those slides could have references, recent references, because again, it is still the student's responsibility to go and read the literature, engage with it when you make your choices around which type of data collection you're going to use, what method you're going to use. Thank you so much, Dr. Sabanda. I'm actually going to ask that we have a very short break because I think you need to take a break. We've been talking nonstop. Maybe you need to grab a glass of water or something. Is that fine for you, 5 minutes?
5 minutes will be fine, Doc, and we
Good.
then look at validation, isn't it?
Great, thanks. And in the meantime, we'll check on the chat as well if there's questions, as well as on the floor while you grab your water. Thanks.
Absolutely, Doc. So we
Thanks.
converge at 10 past, 10 past 10?
Yes. Yes, and maybe just to say, Berthlin said the slides will be made available with the recordings by end of next week. We just want to
Yes.
edit and make sure it's all sorted.
Yeah,
Yeah, and it will
absolutely.
be accessible.
I'll just put this one here.
Yeah,
All
so it will be available.
Yes, ma'am. Let's say next week, then just check and put some references for them also. Will be available next week. Okay. Thanks. Okay. I think are we back, Doc? I think we can go for this one, yes, and this is going to be a quick one.
Yes. Yeah, students are about to sit down. I will tell you now when they're back. Just give me another minute or two, please. In the meantime, you are welcome to share your presentation, put it in slideshow.
Yeah, sure. Let me go for it. Let me see, which one are we gonna do? Let's look at reliability and validity. It's up, Doc. You can see it, isn't it?
Yes, and then just in slideshow.
Slideshow. There we are.
Yes. And then, Doc, I'm going to give you until 10:35 for the
10:35.
presentation. Not
Yes.
10:35. And
Sure.
then from there, we will have tea and then proceed to the next session. So
Then
you have until
10:35.
10:35.
Now I got my
35.
clock here next to me, so we're good to go. Can I take it away then now?
You can take it away. Students are in the space. Thanks.
Okay, thank you, ma'am. Thank you. Right. Welcome back, colleagues. Now, we've looked at sampling and how to approach sampling procedure. We have a cursory look at data collection, and I'm hoping we can have a follow-up workshop. I think Beth is here on data collection. I'd like to go more into that data collection. If we can have maybe sometime a 3-hour workshop on data collection or 2-hour work, so we can interact with our postgraduate students, look at their projects, and see how the data collection fits into their own project. Now, here we're going to look at reliability, validity, and bias. What do we mean by reliability? What do we mean by validity and bias? Now, in general, reliability refers to the extent to which an experiment or a test or any measuring procedure yields the same results on repeated trials. And that is key. And I'll go over that again. The extent to which an experiment that you're conducting, or a test, or any measuring procedure gives you the same results on repeated trials. That is the reliability. And therefore, I just noted for you here that without the agreement of independent observers able to replicate research procedures, or the ability to use your research tools and procedures that you yield consistent measurement. Researchers will be unable to satisfactorily draw conclusions, formulate theories, and make claims about generalizability of their research. So reliability is very important, because we can repeat the same experiment and get the same result. That's what reliability is. Again, I will not go deep into this, but I'll give you just an overview of what is meant by reliability. And then validity. When we talk about validity, we are looking at the degree to which a study accurately reflects or assesses the specific concept that you as the researcher is attempting to measure. In other words, while reliability is concerned with the accuracy of the actual measuring instrument or procedure, validity is concerned with the study's success at measuring what the researcher set out to measure. This is important to understand, the distinction between reliability and validity, the degree to which a study accurately reflects or assesses the specific concept that the research is attempting. I think we all understand where this is headed. Does your study reflect exactly what you're attempting to measure? Researchers should be concerned with both external and internal, and there are ways of measuring this internal validity. So you've got external validity and internal validity. External validity refers to the extent to which the results of a study are generalizable and transferable. The results of your study are generalizable and transferable. That would be external validity. While internal validity refers to the rigor with which the study was conducted, the study's design, care taken to conduct the measurements, the decisions concerning what was and wasn't measured. Number one. Number two, the extent to which the designers of a study have taken into account alternative explanations for any causal relationships they explore. Therefore, in studies that do not explore cause and effect, what we call causal relationship, only the first of these definitions should be considered when assessing internal validity. I'll go back on this again, because the students come back to me with respect to this. I've done a pilot, I've got a questionnaire. I want to re-emphasize again, external validity refers to the extent to which your results of your study are generalizable. That's what we mean by external validity. While internal validity talks to the rigor of the study, how the study was conducted with respect to the design. Remember, I started talking about the design at the beginning, the care taken to conduct the study, and all the other assumptions that you made. So there is external validity and internal validity, and we have seen reliability. And now, next thing we want to introduce here is what we call bias. Bias is systematic errors in the way the sample represents the population. Systematic errors in the way the sample represent the population. That's what bias will be. Now, bias can be due to, now let's think about it, under coverage. In other words, your sample did not cover, is not representative in a way of of the population under coverage. It can also be as a result of non-response. Some of the individuals did not respond as they were supposed to. It also can be as a result of the behavior of the interviewer or the respondent, if it's, say, an interview. Or it could be a result of poorly worded questions. Think about, say, in a questionnaire. Now, I want to go back to that again, just to remind you again, systematic errors in the way the sample represents the population, that would be biased. And we have just outlined some of the reasons for that bias. Under coverage, your sample size, your sample is not representative of your population, or the sample that you have is not the appropriate sample. You've under, I don't want to bring this term now, but maybe you underpowered the study. It could be also as a result of non-response. Some of your people did not respond. It could be because of the interviewer or the respondents or the study participant, or poorly worded questions in your interview. Now, Doc, I didn't want to go again into how we do the calculations of this, but I want just to give them an idea of things that we deal with in terms of reliability. What is reliability? What is validity? The different types of validity and the reasons for validity. And I think for us to engage more, I'm available on the email, and I've got a booking system. We can then go deeper and look at the different measures for reliability, the measures for validity, and we take it up from there, taking into account student projects themselves.
Okay,
Yes,
so,
Dr. Abdul?
yeah, so you can go ahead. There's still more time left. I'm not sure whether you want to still cover more slides. You're welcome.
No, that's fine, Doc. We can take questions now on all.
Okay.
Let's leave the rest for bookings when students come to. It's
Okay.
orientation. So I don't think it's a good thing to pack everything to orient. Let's entice them and let's appetize them on these concepts, and then these are postgraduate students, then they will make bookings themselves. I've got hourly bookings with each student, Mondays to Fridays, though Monday and Thursday I've got classes, so perhaps the best Tuesdays, Wednesdays, and Fridays between 10 and 4 o'clock, you can get your own slot, and then we got an hour to discuss your own particular project. I think we can take questions on this, Doc.
Okay. Thank you, Dr. Sibanda. Just want to check in terms of booking, do they email you, or is there Berthland is going to? There we go. Berthland is putting the link in the chat. And so that link will also be available, perhaps.
Yes, Doc. If you go into the Faculty of Health, or you go to the Directorate of Research, you go to Biostats, you will see there it says make a booking. Then they can book online, and that booking, Doc, then the supervisor, it will request the email of the supervisor, because I always want the promoter or the supervisor also to be in on this. So the supervisor will get a notification. I will get a notification to say a student is willing to meet me at a given time, and then we might even meet together, the student and the supervisor. I always prefer it like that. So I've got the promoter and the student, then we discuss this together at the same time. It becomes more productive, but sometimes students can come by themselves, but it's always good for the supervisors to keep track also of these discussions and engagements with me.
Thank you very much, Dr. Sibanda. And then I'm going to assume that it's available both online. We have online sessions, and students can come and visit you at your office as well, I'm assuming, or is it only online?
Absolutely, Doc. I use Mission Vale campus sometimes for face-to-face meetings, but many students now prefer to do it online because perhaps they are at a different campus, they can travel to another campus. So it's not a problem. Or I'm available both online and on Teams, but we need to make that particular arrangement during the booking. So you'll specify, I'm looking forward to say an online meeting on Teams or a face-to-face meeting. But it always works well, even on Teams. Students are able to understand things.
Thank you so much, Doc. Okay, so I think we have a hand online. It's Moheseng. You are welcome to unmute and pose your question.
Thank you, Doc. Thank you, Dr. Sibanda, for the presentation. Just two questions. The first one is a follow-up question from yesterday's presentation. We just wanted clarity in terms of the pilot study. What is the percentage that we need to look into? The second question you presented on the different types of data collection in terms of the primary data. And I was just looking, you mentioned observation surveys, interviews, questionnaires, and schedules. And I'm struggling to identify where my data collection tool falls into, because I'm just gathering information that I am actually extracting from prescriptions. So it's sort of like a self-designed data collection tool. So where does that one fall into? Thank you.
Thank you again, ma'am. Thank you very much. Pilot, ma'am. It's a pilot. Sorry to put you on the spotlight, but I think we can discuss. I want to throw a question back at you. Why do you want to do a pilot? In general, what is the purpose of a pilot?
I want to do a pilot just to strengthen the reliability of my study. Also considering that the research that I'm doing, the actual research hasn't really been done so much. So just to test my data collection tool, if I can put it that way. Thank you.
Absolutely. You hit the nail on the head. That is exactly the point. We're piloting so we can test our data collection tool to ascertain if really, in simple terms, we're barking at the right tree. Have we designed the study right? Are we collecting the right data? We look at issues of reliability, look at consistency. I've just talked about validity here. You know, those type of things. We want to use the pilot so that if there are issues, maybe with the data collection process or the design of the data collection tool, we make those amendments at the pilot level, at a small scale, as opposed to doing the whole study and picking up these problems. You're absolutely right. But then the million-dollar question is, how many individuals, if that's what you're looking at, or how many items are enough to make up a pilot? What is a sufficient number for a pilot? We always say, ma'am, as a guide or rule of the thumb, that 10 to 15% of your sample suffices as a pilot. Keep that in mind. But here's the proviso. The proviso is provided that the sample calculation itself or the sample determination has been done in a very robust and above board way. If you understand where I'm going, ma'am, have you taken everything into account and in your sample size calculation, and your sample size is the right sample size you should have. Therefore, if all that is done right, your pilot is ideally should be about 10 to 15%. Some people say up to 25%, but within that range, you are fairly safe. So let's say 10 to 25% of your sample can make up your pilot. Does that answer that particular question, ma'am?
Yes, it does. Thank you, Dr. Sibanda.
Yes, ma'am. And then in terms of your study, you're collecting clinical data, is it not?
Yes, correct, Doc.
Yes. So you might want to create your own data collection tool, is it not so? So this is retrospective. You know what I mean by retrospective data?
Just
it-
vaguely.
Is retro, it means old data, isn't it? This is secondary data, isn't it, ma'am?
Yes, correct, Doc.
So it's in is case files or patient files?
It's patient files.
It's patient file. So then you have to create your own data collection tool. It's up to you how you collect that, but I'm free also to you can drop an email, or let's meet and discuss that online or face to face. But what you need to do is look at the variables. In other words, the questions you are asking them. Then you can group those questions. You say, for instance, I give an example. I want to look at these variables. So you will have the first question dealing with, say, you create an ID code for your patients. Then you create, you collect data on the demographic variables maybe, and then you collect data on the subject matter questions that you have. So you create that data collection tool for yourself, because you're not going to give anybody to collect. You create it for yourself with a different heading. So you can have maybe the name of the patient, but you see you don't have patient identifiers, so you create a code for the patient. Then you can create male, female. These are defining demographic features of the individual, isn't it? And things like that. So you create that data collection tool yourself. It might not be any one of these that you have, because yours here is a retrospective or secondary data. You will have to create your own, taking into account the particular questions that you want to answer. But if it's not very clear, ma'am, let's discuss. Drop me an email. Let's discuss that. All right.
Thank you, Doc.
Okay, ma'am. Okay.
Okay. Okay, thanks, Dr. Sibanda. Any questions from the floor, maybe around your own data collection, or go ahead?
Morning, doctor. I just want to ask, if you're using questionnaires, is there a minimum amount that you need to make it valid,
Okay.
to get valid data?
Difficult. How long is a string is the question, isn't it, ma'am? But then again, come to think of it, there is no hard and fast rule when it comes to that. But too short a questionnaire might sell you short, isn't it? Might shortchange you in terms of the data you want to collect. You might lose out on some data. But too long a questionnaire also, you might create situations where your respondents leave out some questions because of fatigue, or people just get bored. They don't want to carry on with the questionnaire. It's too long. And even if they complete all of it, they might not be paying attention now. They might just be doing it to make you happy, because it's too long. They're just ticking things, if you understand what I'm saying. So there is no hard and fast rule. There isn't. It really depends. But go back to the drawing board and be honest to yourself in terms of the important questions that you need to have answered, and deal with those. And then all the other secondary things can come in, but deal with the primary questions that you want to ask that relate to the aim and objectives of that particular project. That should suffice for that questionnaire. But there is a simple answer is there is no hard and fast rule, ma'am. Think about too shortchanging yourself. Too long, you might not get the responses you want because people are not interested. People have other things to do, and people are perhaps not, you're not giving them a stipend for that, unless perhaps you're giving them a stipend or you're giving them an incentive of sorts, and then people can then sit and do this because they will get some kind of remuneration from you, even if it's very low. But try and strike a balance. First, understand your research question. Look at your aim and objectives. Design your questionnaire in such a way that you capture the fundamental questions that you need to have answered in that particular project, and that should suffice for the proposal. I'm not sure if that answer is sufficient for you, ma'am.
Yes. The student says that's adequate. Thank you so much. I don't know if there's one last question, or are we good to go to tea time? Anything online? Just doing a final check and on the floor. Okay, then we are breaking for tea time. Thank you so much, Dr. Sibanda. And also I do want to apologize for hastening you at some points. I understand there's a lot of important information that you want to cover, but I'm sure that we will have workshops set up in the faculty for students to go deeper and to engage you further on these different presentations you made this morning. Thank you so much. We appreciate it. And then students are encouraged to make those bookings with Dr. Sibanda, and definitely having your supervisor present or your promoter present is encouraged as well and preferred. We'll have a tea break, and then we will start again at 10:45 for the next presentation on descriptive analysis and plotting graphs using Excel. Thank you.
Thank you, Doc. Thank you very much.
We are having Dr. Oyedele from the Nursing Science Department, and the researcher and lecturer, and going to present on descriptive and graphical analysis. You are most welcome, Doctor. You can go ahead and do your presentation. You have until 11:30. Thank you.
Pleasure. Thank you so much, Chairperson. Good morning all, or good afternoon, or good day, everybody. I'm Opoluwa Oyedele, and I'll be taking you briefly on descriptive and graphical analysis using Excel. Before I do that, I would give you the quick 411 of what is descriptive statistics or analysis in this case, and then we'll see how we can apply this theory we just learned in Excel. It will have been advantageous if we literally the computer in front of us, so you can do what you see in Excel, so you can get the practical experience. But the circumstances is still fine. I hope my slides are more enjoyable. Okay, let's start. What is data? We've had data. We've had so many presentations on it, even yesterday and early today. So data is just any collection of information. It can be your age, your gender, the HIV status, the measurement of volumes of bacteria, and blah, blah, blah. Now, however, when collecting data, we need to pay attention to the types of data we are collecting. In particularly, how are these data measured? Because the type of measurement of this data tends to influence the type of analysis you can do and the type of analysis you must do. So there are 4 types: the nominal, ordinal, ratio, and interval. So the nominal one is when you have kind of like a categorical variable whereby your data are not in specific numbers, they are just in category. Like, for example, if I ask you what is your gender or the gender of the patient, it's male, female. What is the occupation of the patient? Is it a student, a professor, a lecturer, or a truck driver? All these are their answers, but they are not numeric, they're in category. And just because they are in category, there's no level of importance among this category. So in that case, there are specific analysis you use for these types of data. Then the next one is something called ordinal measurement, aka ordinal data. It's sort of similar to nominal, meaning it's categorical. However, there are some kind or types of ranking among this data. For example, if we were to look at, let's say, the performance of a patient in a particular drug, a patient who tested well to this drug or vaccine is much, much better than the patient who did not test well to the vaccine, thus needing maybe further intervention or so. But if the type of information you collect, if it's if some kind of ranking in it, then we are bound to use some ordinal related analysis. At the end of the day, you can use them, but depending on the software you use, you'll be asked specify the type or the types of measurement or scale used for the data before you proceed. Like, for example, if you're using SPSS, SPSS will ask you what is the type of the data before you proceed in the analysis. But for Excel, Excel just does everything for you. It's up to you to know beforehand. Okay, then there's the third one is something called interval measurement, meaning your data information or your information that you collected, they are numeric, but they're in kind of like interval categories. Like, for example, maybe you want to look at the temperature of the patients, you want to look at the age group of the patients, so you can prescribe a better vaccine for them. If that's the type of data you have, use interval-specific analysis when doing your data analysis for your work. The last one is something called ratio, which is sort of similar to interval, except here there's a possibility of having a zero. Like some data, when there's zero, it means maybe non-response or so. But if your data actually has a meaningful value that says zero, like for example, how many cigarettes did you smoke in a day? If you're not a cigarette smoker, obviously your answer will be zero by default. However, if maybe you're a cigarette smoker, but it just means for that particular day the question was asked, you didn't smoke, then your answer will be zero. So if there's a possibility of having a zero, which zero also means a particular group of response, then in that case, you are most likely doing a ratio type of analysis or data, because your data is ratio. Okay, so in short, once you get your information, either questionnaire or testing or experimental, once you get the data, before you proceed to analysis, you always ask yourself, is it nominal, ordinal, or at the ratio or interval? Because if it's nominal ordinal, it means your answers are in a category. And if that's the case, you are most likely to do some qualitative related analysis or some grouping statistical analysis in the end. However, if your data are in numeric, and maybe it's a ratio where zero is not meaning something else, but zero means something meaningful, and then interval, maybe you have two answers at the same time. If that's the case, then you are most likely to use a more quantitative related statistical analysis when analyzing your data, aka the numeric analysis. But like I said, depending on the software you use, some software like SPSS, before you proceed to the analysis, it asks you to specify the type of measurement or measuring scale of your data before you can select. If you choose the wrong one, it gives you a wrong list of analysis you can choose from. Okay, so now before we jump into analysis, particularly if you're doing like maybe a questionnaire, it's always advisable to scan through your data before you proceed to analysis, because if you don't check through all those mistakes, all those typos can cost money as well as time, and also cause and give some questionable results that it will be very painful to pick only after you've analyzed your data. So before you jump into analysis, you always need to check three things, aka you edit, you classify, and you tabulate. For example, you will check for maybe some ambiguities or errors or omission. Like for example, maybe you ask patients to specify their age, but then along the way they decide to choose two different age groups. You need to check that or check for the omission quickly before you analyze the data, because once you analyze data, you always want to use the results to generalize to the whole population. However, if your data is full of mistakes, that can cost you a good interpretation, and thereby resulting in you giving a very questionable policy or recommendation to fix the problem you are researching. So here you always check, and then you always do pre-testing. And sometimes omission are not, or ambiguity or errors, they are not the respondent's fault. Maybe they don't understand the question, or maybe they understand the question slightly, or maybe they're even confused, or maybe they forgot or escaped their mind. So all this needs to be fact-checked by doing either a pilot study, or maybe meaning you give your questionnaires to maybe a few people or a few respondents, and then see how they respond, and see, is that the kind of response you want, or you want to correct your questionnaire. So you can do it before you do analysis. So if you have a nice statistician, they can do it for free. However, if you are the one paying a statistician to do your data analysis, if there's an error, they'll do it for you. But just know, if you want them to redo the analysis, you have to pay double at the end of the day. So if possible, always fact check or double check your data for ambiguity, errors, and omission before proceeding to data analysis, either by yourself or if you are paying someone. Okay, and then the next thing is, sometimes you need to reclassify. Like for example, maybe you ask the questions like specify your exact age. Sometimes some analysis or the type of analysis, data analysis, requires you to convert this exact question into categories. Like for example, if I mentioned that, oh, my age is 20, 21, 22, sometimes some analysis, depending on the software you use, they want this 20, 21, 22 to be grouped together into, let's say, 20 to 21 or 20 to 22. So if that's the case, always classify or reclassify your data before you go to data analysis. And then the last one is, you need to put your data in a tabular format, like preferably in Excel. So you can go column 1 is question 1, column 2 is question 2. This is much important and relevant for people who are doing questionnaire-based research. And then if you can get that, then you have a smooth sailing to data analysis without any questions or annoyance as we proceed. Okay, now let's quickly look at a quick overview of descriptive analysis, and then we'll now move into Excel. So when it comes to descriptive analysis, the keyword is descriptive. You are describing. So you need to describe your data. Remember, we, the reader of your research report, we don't want to see your raw data. Probably you can't even print it. Imagine if you have 1,000 respondents. We don't need to see their responses. We need to see a summarized version. So now the question is, do you summarize numerically or do you summarize graphically? And the reason why you need to summarize is because you need to have a quick glance or a quick summary information about your data, so it will help you when you're interpreting your results and making your recommendation for your research. And also you can also quickly detect any typo or outliers. Like for example, if you see that out of your 1,000 respondents result, when you tabulate it, you see that this respondent is mentioning 2 different age groups. You can easily pick it while looking at the numeric or graphical analysis, and then you quickly correct it before you go into in-depth advanced statistical analysis. And then sometimes you can easily pick up similarities in your data. Like for example, maybe it's a pattern. I don't know, maybe you're looking at a particular vaccine effect or so. You can easily pick it quickly from your data analysis before you go and do advanced data analysis like the inferential analysis. Okay, so then from there, all this needs to be checked, and you need to always do a description analysis before you go into advanced statistics. That will help you detect errors, mistakes, typo, as well as guide you on how to interpret your results at the end of the day. Okay, so there are 4 types of graphic descriptive statistics or descriptive analysis. The last 2, some people group them together, but for me, I prefer to separate them such that you can choose the one you want to choose at the end of the day. So the first one is the tabular one, which is a must because you are describing your data before you even do analysis. Tell us what your data is. We don't need to see your data, your raw data. We need to see a summarized version of your raw data, and it can be tabular, meaning a frequency table or cross tabulation, meaning you can describe your data individually, one at a time, or you can describe your data 2 variables at a time. For example, how many females reacted to this vaccine positively, or how many males were diagnosed with this positive result. So it's up to you. And then the next one is you can give us your data in graphical format, which is a pie chart, which is a bar chart, or a box plot, in case you are looking at an intervention research, or it can be histogram. Excel has so many. Excel can tell you, even recommend a chart for you. And at the same time, you can also give us a summary statistics, meaning in numbers, like give us a particular number, and then you interpret it. Like for example, the mean is, or the range is between 1.5 plus minus 2.0. If you mention that, we all know what it means, but it just means you're summarizing your data in numbers. At the same time, you can also summarize your data in the form of association or variation, which sort of stems from cross tabulation, meaning like you can quickly tell us, is there any relationship between the age of the patient and their, let's say, their current morbidity or illnesses or comorbidity before you even do the statistical analysis. So it's up to you to choose which one you want to choose. However, I always tell people who ask me for opinion, when it comes to statistical analysis, when you're describing your data, what you give us in the table, don't give it to us again in a plot. No, like you can either choose tabular and then give us the rest in graphical. Don't give us the same thing in tabular, in graphical, and in summary statistics. You are just sort of recycling the same information, and for students, you are just sort of like wasting paper, which is not nice. So if you're gonna choose maybe the first 10 variables to be in tabular format, wonderful. Then the next 10 can be in graphical, but don't give us tabular for the first 10 and then graphical for the first 10 and then summary statistics for the first 10. You are just wasting time. Okay, and then most computing software can do this. It just depends on which one you are flexible with at the end of the day. And then don't forget, when you are writing your reports, always mention the computer software you used, or you are going to use, or you use to analyze your data, as well as the version. Is it like a last year's version or 2 years ago version or the current version? Because some version, as the year increases or progresses, so does the the version of computing software, they get updated regularly. So some updates might not have the latest statistical analysis, some might, but it's always nicer to mention the type of software you use as well as the version in your report and proposal. Okay, so for example, let's look at the frequency table quickly, how it looks like in theory. If you are looking at the length of service, let's say of maybe a medical officer at a particular hospital, government hospital. So we don't need to see this in your report because this is confidential information between you and the respondents and maybe your code team, your code research team. However, we as the reader of your report, we need to see the summarized version. So thus give it to us in frequency table, if you want to use a frequency table, which looks like this. So this already sort of gives a sense of confidentiality. Like for example, the age group of 18 to 20, without me seeing the length of service, I don't know how many 18 you have. I don't know how many 19 you have. It gives a sense of confidentiality on your part as well as the part of the respondents. However, when you give us something like this, don't say or see the appendix for the raw data. It's not nice because you are breaking confidentiality, which is one of the rules of ethical governance at the end of the day, particularly for students who like to attach so many appendix. So please don't give us raw data, give us the summarized data, either in tabular, summary, or in graphical. So this one gives a sense of confidentiality, which is still good. And then it's always nicer to always give like for example, how many people fell within the age of fell within the length of service of 18 to 20. It's always good to give us the actual count as well as give us the percentage, because when you're interpreting it, it sounds much professional when you interpret in percentages. However, for students, I would always tell them it's nice to give us the count as well as the percentage, or vice versa, when you're interpreting your tabular table. I mean, your tabular information. However, do not interpret everything in your table. No, just give us the minimum, the maximum, because we can see the table. You even make reference as shown in table 1. So for people who are curious, they can go and look for table 1 and see the information themselves. So do not interpret, for example, for this table, do not interpret all 6. You can just interpret the minimum and the maximum, then you move on to the next table. Otherwise, you'll be sort of like wasting paper and then recycling the same information over and over and over again, which is not nice in the academic writing format. Okay, then the next one is something called cross-tabulation, which is sort of the same thing as the frequency table, except here we are not describing or summarizing our data one at a time. We are doing it 2 at a time. Like you can't make a cross without 2 things. So when you look at the cross-tabulation, it means you want to interpret, give us information about how this happened when the other one happened. So it's for me, I always tell students, if possible, try and stay away from frequency table because you're going to have so many of them. However, in a cross tabulation, you can easily have fewer of them, so you can have more space for the graphs and the numeric summary. So a cross tabulation is just you summarizing 2 things at a time, which is a good thing and it's very popular in the health and social science research area. So for example, if you're looking at the application of 12,500 applicants who are applying for, let's say, a level 1 lab technician at a certain medical clinic. So this is a good information that we, the reader, needs to see. We don't need to see the application result of each and every individual applicant. You are breaking confidentiality. So you can give us the information, summarize the information, your data in this format, which is very good, but at the same time, I can't help but notice they're summarizing 2 things at the same time. Like, for example, 1 minute they're talking about the gender, the sex. At the same time, they're also talking about the application status, if they were rejected for the post or if they were accepted. So this is a very good description of the information obtained from these 12,500 applicants for the particular job. So like, and then this is also nice, but as an experienced researcher, it's nice, but not too nice. So, however, you can still give us percentages. Like this is even much, much better, whereby you give us a percentage and more informative. You give us a percentage, the gender and the accepted application status. At the end of the day, you do not need to interpret each and every number in this table. No, you just focus on the maximum and the minimum. Always make reference and then show the table. Like, for example, table 2 shows us information about the gender and the application status of level 1 applicants at the certain medical clinic. They just mentioned majority were this, while minority were that, as shown in table 2. Then you move on to the next one, because we can see the table for ourselves. You don't need to waste time and pages interpreting each and every value in the data. In the table. And then moving on to the graphical one, again, like I said, do not give us information in the same information in the table and then the same information in the graphical. You are wasting time and wasting pages. So for the graphical one, you can give us in a bar plot. A bar plot is just a bar, even from the name, a bar. So it just means.
Are you going to email Dr. Kubashe or?
Okay. So sorry, a bar chart is just like you representing each category, each information using bar. So the group that has the highest, let's say highest frequency, meaning highest number of people, they tend to, or highest number of events, they tend to have a tall bar. Where the smallest one has where the smallest bar contains or just shows that this particular category has limited information. So at the end of the day, it's much nicer. You are still summarizing your data without breaking confidentiality. And again, do not interpret all the bars you see. Focus on the minimum and the maximum, aka majority and minority. Like for example, for this one now, you can just say majority of the people worked at this particular hospital for 1 to 5 years, while minority were between 16 to 20 and then 20 to 30, because there are two smallest events. But again, do not interpret this bar and then the next one and the next one, and no, just focus on minimum, maximum. Otherwise, you are sort of like recycling the same information over and over again. Meanwhile, you could have used that time to do more discussion or recommendation. Okay, then another same bar graph, but another one is you can tilt it a bit, like you rotate it to give it to us in this format. Meaning there's the rejected and then the accepted. But again, this is for the two information at the same time. This is from a cross tab. This one is just talking about one class, maybe the length of service. But this one is talking about gender, blue and the red one, at the same time talking about the application status. So hence you have sort of like the rejected one and the accepted one. Excel can show you all this, and I will show you quickly in the next part of this presentation. At the end of the day, do not give us the raw data. We only need to see a summarized version of your data, either in tabular format or graphical format. The most popular one is a pie chart, which to me, I always call it a star chart, where each slide represents a particular group, and then it gives us information. But the thing, one of the disadvantages of pie chart is if you have more than, let's say, 7 groups, because there are 7 colors in the rainbow. If you have more than 7 groups, like if you have like 15 groups, your pizza becomes very clumsy. Your chart becomes very clumsy, very close to each other, that you can hardly differentiate between them. So I always tell people, if your data that you want to summarize using pie chart, if it has, let's say, maximum 7 categories, minimum 1 or 2 or 3, but maximum, let's say 5, between 5 to 7, then you can use pie chart. However, if you have more than 7 categories, I would recommend you use a bar chart, because at least a bar chart, the more groups you have, there are so many spaces you can see, the groups are not overlapping. Like for example, I can easily see, you can even easily see which group this one is, which group that one is, and there's spaces between the bars. So a bar chart is more recommended if you have more than 7 categories, 5 to 6 or 7 categories, than a pie chart, because a pie chart, it just means everything must fit this circle, the 360 circle. So the more groups you have, the more mushy and clumsy and close to each other the categories will be, and then you can hardly see it. And even Excel will run out of colors. And then, for example, like you can even have 3 different blue colors, but then you're not sure how to interpret it. So if possible, stay away from pie chart and preferably you use a bar chart. Okay. And then the next one that is mostly popular in the medical field is something called box plot, which is particularly people who are looking to do like an intervention study, because a box plot just gives us a quick summary, 5 points, minimum, maximum, and then the quantiles, median and the quantiles. So like, for example, the minimum, maximum, it just tells us the criteria. For example, like now, it shows us the outlier. outlier means in health science, it just means outliers is just the people who really need urgent intervention. Like for example, like now, if you are in this box, if you are in the box, you are safe. You are very safe. You don't need intervention. However, the more you deviate outside this box, the higher your level of urgency for intervention. Like I said, it's very popular. Some call it the Wickska plot, but most of us will call it box plots, but we're still saying the same thing. So it's mostly useful. Some software, they do it like this. Some they turn it the other way around. But bottom line is you want people to be inside this box because it means they're safe. But then as they are deviating outside the box, it's just highlight the level of importance or urgency for their intervention, particularly if you have to look at the COVID scenario, or now I think there's is it cholera or malaria. So we can just see if they're in the box, the safety box, they're safe. But the more they are deviating, as they keep progressing to the maximum, it just highlight the level of urgency to maybe start treatment or so. Same thing for the minimum as well. Okay. Then just some mathematical calculation, which I'm gonna skip. Okay, then the next one is summary statistics. Summary statistics, again, you are summarizing your data. We don't need to see the raw data. Give us the summary. Like for example, if I say mean, then you can easily know, okay, the mean is describing on average. Here's the situation on ground. If I say mode equals 3, it just means the number, most people are in this category. So it's still part of summarizing data, but you're just using one numeric single value to summarize your data. And there are so many of them, but the most popular ones are the 3 M's: mean, median, mode, the range, deviation, minimum, maximum. So the deviation just shows the dispersion within your data. See what's the distance between the minimum and the maximum. Same thing as the range. And then we all know what minimum maximum is. And then the mode just means the number of, the most frequent occurrence in the data. So all this can be used to summarize your data because we don't need to see the raw data. We just need to see a summarized version of the raw data to further understand your research as we progress. And all computer software can do that. And then moving on to the fourth type of descriptive technique, descriptive analysis technique, is something called association. So you want to quickly see if two things are related, like just quickly by doing simple calculation, just a number, just one number, numeric, one number, it tells you, okay, there's correlation, meaning they're related, or maybe they're closely related, or there's no correlation, or that they're just equal. You can easily see all this by performing descriptive analysis, aka the correlation or association, or as we proceed. So here, it just shows you the strength. Like, for example, are they closely correlated or are they weakly correlated? Just one number can tell you all this information, two information at the same time. So hence why I said the third and the fourth description analysis technique is, for me, they speak to each other, but some people tend to separate them, but it's still fine. Okay, so for example, if you say two things are related, like meaning as one is going up, the other one is also going up. Like for example, you can see cost of living and inflation. They're going up and down. They're both going up at the same time. So if that's the case, only one number will tell us. For example, graphically, it looks like this. Meaning this is the first point, that's the last point, the one on top. So for you to go from point 1 to point N, you literally have to climb the staircase. If you are climbing staircase, then you are literally, there's most likely a positive correlation between the two variables. So if that's the case, we just say they are positively correlated or associated. Like I said, number can tell us this. Like if you look at the picture, you can easily see it. However, a number can also tell us as well. We'll look at it as we progress. The opposite happens. Like as one is going up, the other one is going down. Like for example, for students, like if you look at the money you have in your account in January, I guarantee you, come December, when you look at your account, it's not the same money. Something went down. So if that's the case, it means if you are going from point number 1 to point number N, you literally have to go down the stairs. Hence, we'll say they are negative correlated. Again, a number can also tell us this as well. We're going to look at it as we progress. Then if there's no correlation, meaning they are not associated, like there's no possibility of any association, then graphically speaking, when you look at the map, you can't even see, am I climbing a staircase or am I going down? You can't easily see. But you can see up and down, that kind of wavy pattern. If that's the case, then there is some sense of no correlation in between these two variables. But like I said, a number can also tell us this by looking at the number. You can say, oh, definitely they're not related, or definitely they are related, or definitely there's no correlation. A number can tell us that. So the number is something called correlation coefficient. Like I said, all computing software can do this, but the trick is, how do you interpret? How do you know it's positive? How do you know it's negative? How do you know there's no association? It's very subjective, but universally, we sort of look at it like above 0.5 or 0.7. It means that there's association, and below it is no association. So me being a statistician by training, I like to draw the number line. So we know correlation is between 0 and 1, meaning it can be positive 1 or negative 1. So I'm giving it to you like that. So anything, if your value is 0 on the dot, it means there's no correlation. Right? They don't relate. They are two different things. They are independent of each other. No relationship, no association. So now the question is, how close are you, or how far away are you from 0 to 1? Either +1 or -1. So the plus just means it's positive associated, meaning they are both going up at the same time, where the negative just means it's the inverse relationship. As one is going up, the other one is going down. So, but it's very subjective to know how to define a very good correlation. It's very subjective, but mostly we use anything above 0. Plus minus 0.5 or 0.6. Then we interpret it. It is universally known or used at the same time. So, for example, I'm saying this is positive because of the positive sign of the 1, and then this is negative. In the computer software you're going to use, it will also give you negative or positive. So, as that will tell you either it will also give you negative and a positive sign. So just take the sign as negative. If it's negative sign, it means negative relationship. If it's positive, then sign, it means a positive relationship. The value would tell you that on the software. And we're gonna look at it as we progress. So here, let's look at the positive one, for example, 0.5. Like I said, most people use 0.5 as the cutoff. So anything 0.5 and above means positive relationship. Anything below is a negative. But if it's 0, if it's going close to 0, then we would say there's no relationship or weak association. So in this case, because sign is a negative, so we are saying it's a weak negative relationship to 0, because if you are going from this minus 0.5 to the right hand side, it's you are going towards no correlation. And then if you are going to the other one, then we are saying it's a fairly negative correlation from this 0 point. So the closer you are to 0, the weaker no association you're gonna get. However, the farther away you are from 0, the higher your correlation, the stronger your correlation. And the closer to either plus or minus 1 you are, the stronger the relationship, negative or positive. Then for the positive one, it's still the same thing. So it just means you are going from 0 to +1. Again, 0.5 is generally used as a cutoff or universally. And then as you are progressing, the closer you are to +1, the very strong your correlation. However, the farther away from 1 you are, the closer to 0 you are becoming. And then we all know the closer to 0 you are, the closer the weak or no relationship you're going to get between the two variables. It's just a matter of you understanding, where do I cut off? So you can use 0.5. Most reports, you need to specify your cutoff, because there's no universally known accepted number. It's very subjective, but it's always between 0.5 to 0.7. So in your report or in your methodology, before you interpret, you can specify a correlation value of more than 0.5 is considered good relationship association or something. Always specify the cutoff value you use in your report, so that whoever is reading it can understand it, because you don't know what cutoff value they are used to. But if they can see the one that you use, then they can understand your results and conclusion and recommendation based on your analysis. Okay, so in the notes here, we are saying this: if the value you get from your software gives you 0, or 0.0001, or 0.2, or 0.3, the fact that it's very close to 0, you are tending towards no relationship. However, if you are getting a value that is very close to -1 or -1, it just means there's a strong negative association between these two things you are comparing. And then if you are getting a value of positive one, meaning a plus sign, that means that it's very strong, the association between the two variables you are comparing. However, if it's plus minus 0.5 or 0.6, we are saying maybe there's a fair to strong or moderate correlation. And then if it's between bigger than plus minus 0.7, it's still moderate to strong. But like I said, there's no universal rule that says your value is bigger than this one, it means it's a good relationship or bad relationship. There's nothing like that. But from my experience and from what people have been doing thus far, they always use between 0.5 to 0.7. But choose your own between this 0.5 and 0.7. But don't forget to list it down in your report so people can easily follow your interpretation at the end of the day. Okay, then how do you calculate the correlation value using the software? There are so many of them, but there are 4 popular ones. So there's the Cow-Pearson, there's the Spearman, there's the Kendall-Tau, there's the chi-square test. Some of you might have done this like thoroughly in your undergraduate or even in your honors project, your 4th year project. So, but I'm just giving you information. But you don't know which one to use. It all boils down to the type of your data, like the measurement that was used, the scale that was used to capture your data information. For example, if your data were numeric, meaning interval or ratio that we saw earlier on, if your data falls there, then you are most likely to use either the Cow-Pearson or the Spearman or the Kendall-Tau. At the end of the day, you're going to get the same result, interpretation-wise. However, if your data are in categories like your age group or the HIV status or the diagnosis or status or the results, if it's categorical, you are bound to use a chi-square test method for calculating your correlation. For software such as SPSS, before you can even jump to correlation, it asks you, what is your data scale? What is your data measurement? Before you can proceed. In Excel, well, Excel is just a click. You have to think for Excel before you do it. But sometimes SPSS, you need to answer some questions before you proceed. For other packages, you also have to specify as well. But this is very important. You just don't do any correlation measure. You want to check association. You need to check, is my data categorical? Are they numeric or order? Or nominal, ordinal? Are they ratio or interval? That will guide you to which technique to use at the end of the day. But the interpretation still stays the same at the end of the day. Okay, so for the Pearson, it is something like this. So it's kind of numeric, but like I said, all software does it for you. Computer software does it for you. The job is just to interpret the answer you get from this. So this is what goes on behind the scene before you can get a value, for example, 0.555 or something. This is what goes behind the scene that you don't see in the computer software. Your job is to interpret the output given to you. So this is a Pearson. Obviously, we need to calculate, because you're calculating, you need some N and some X, the mean and the variance. Hence, your data needs to be numeric, not categorical. Then for the Spearman, because it's also ordinal, also numeric, but there must be some sort of like maybe ranking among your data. So if that's the case, again, this is what goes behind the scene. You still get one answer, either 0.667 that you need to interpret. See, either it's positive or negative or no correlation. At the end of the day, what goes on behind the scene, but you need to know what type of data am I getting? Is it numeric? Is it categorical? Is it nominal? Is it ordinal? Is it ratio or interval? All this will guide you in the type of analysis to use. We're going to look at all this in the part B of this presentation. Like, for example, if I'm looking at maybe the cost and sales of, let's say, a new cold or flu medication in town to see how people, as a business person, to see if I'm making profits or losing profits, or is it worth investing in? So I do like a pilot study, and here's the information. So I want to see, does the cost of me advertising this product on SABC, does this cost, is it increasing my sales, my profit at the end of the day? Because I'm a businesswoman, so I need to make money while promoting my product. So I need to see it before I can invest, let's say, 10 million or 10 trillion into it. So because it's numeric, like you can say it's 15, it's 12, it's 18. Oh, these are all in range, by the way. They're 21. I can see they're numeric. So obviously, the best approach I can use to calculate the association between these cost and sales would be a Pearson correlation, because there's no rating, there's no ranking, it's just numeric. So hence, whatever software I use, I will enter my data, then under the type of correlation, I'll just look for Pearson or Cow-Pearson, and then I click on it, then the computer does the behind the scene and give me an output. So when I do it, the output I'm going to get will be 0.6503. Now it's up to you to interpret what this one means in terms of relationship. So when you do it, like in this case, because I don't see any negative, so it's positive correlation. And then it's far away from 0, but also 10 close to 1. So I would say maybe fair or moderate. So if I see this number, I can interpret it as a positive and fair relationship or association between the advertising cost and sales. So meaning, as my cost is going up, so is my sale. So thus, I need to invest more money in advertising my product so I can get more money or more profit to my business. So all this information was obtained just looking at this number, 0.6503, this correlation. And okay. Then
Dr.
yes.
Oyul, I just want to alert you have 5 minutes left, and we just want to also give students an opportunity to ask questions as well.
Okay,
Thanks. I'm just
moving to the
letting you
next.
know.
Okay, thanks. So now we've seen the basic information. At the end of the day, we just need practical one. You just need to columnize your data, bullet it, either frequency or cross tab. Then you visualize it, bar chart and all those, and then you summarize it. Moving on to I'll need to stop sharing to the practical one quickly, which will take us 5 minutes to do anyways.
Okay, thank you so very much. Right, students, now is your opportunity to ask questions regarding the presentation. And then, Doc, I'm sure your presentation will also be available to students with the references as well. Okay. Are there any questions on the chat, on the floor?
I thought I still have 5 minutes to talk.
Oh, are you still talking? I was checking whether you want to talk or because I just say something about questions.
No, I was saying I was going to the next part, which is the Excel one.
Okay, then go ahead. My apologies.
No, it's fine. So in Excel, you just need to get you need to get this data analysis tab. So from Excel, if you haven't done it, some Excel you need to install it in Excel or call it out or add it in your Excel. So when you add it in, you just go under File, Information, Option, Adding, then Analysis. Then you go to Analysis Toolpack. Then when you follow these steps, the thing would automatically add in the Excel. So when you do this part, this is your data analysis. And when you click on it, it shows you all the types of analysis you can do. Either it's correlation or descriptive analysis, media mode, or if you want to do a bar chart or a graph chart, and so many of them. But then you might need to install it. So you just go on under your data, the data in Excel, and then if you don't see this analysis, it means you need to install it to call it following the steps over there. So, and then there's so many F-test, T-test, histogram, and ANOVA regression as you are doing, so on and so forth. But it's up to you to select which analysis you are looking for. And then you must, once you do select, you need to also know how to interpret the output you are getting in Excel. Because that's the whole idea of data analysis. You're analyzing the data, you're interpreting the data. So, okay, I will skip this one, but majority of you are bound to use that one. Not all the analyses are useful to you because Excel is not done for you guys. It's done for everybody, including the business area and the sociology and law. So just find the analysis you want to do based on by skimming through the list of analysis you want to do at the end of the day and your progress. Okay, so because of time, I will just probably just stop here, but it's kind of like easy because it's Excel. You just need to click, and then you get your answer. But the key thing is you should be able to interpret the output of what Excel is giving you. And I will stop here.
Okay, Doc. Sorry again for that interruption. I heard you saying questions, and I thought you were asking for questions from the students, but are there any questions from the students? From the floor as well as online? Berthlin, anything? Okay. Then thank you so much, Doctor. It doesn't seem there's any questions. I think they're busy processing all the information you've shared. And then again, the presentation will be available with the references and then also the recording if you want to watch it again. We're going to welcome Dr. Sanderson for the next 2 slots actually. Yeah, I think you're going to manage the 2. We can first do the 1 and then have question and answers and then the next one. Thank you. Thank you very much, Doc. We appreciate.
Pleasure.
So Dr. Sanderson is from the psychology department, and she's going to focus on data collection and analysis, particularly qualitative data, looking at tips and challenges. Dr. Sanderson, most welcome. And you can take the floor.
Thanks. Okay. So I'm imagining everybody is able to see the slides online. Okay. Right. My focus first this morning is looking at qualitative data analysis. So we've just heard a lot about statistics and graphs and things, which I will admit I know very, very little about. That is a completely different form of data that is going to often summarize or have a numerical value to what you are exploring. Whereas qualitative data is known that it's data that comes in words, descriptions. Okay, so qualitative data analysis is non-positivistic. So if you don't know the word positivistic, is usually the word associated with data that's numerical because it's exact. You have a sense of, 1 + 1 is 2. You have an exact outcome. That is positivistic data. Whereas qualitative analysis is usually non-positivistic, which means that there is more than one version of reality, right? So when we, for example, do interviews with different participants, the likelihood is that there are going to be variations in what those participants have to say. Does that mean that one of them got it wrong? No. All right. It means that they're presenting their reality, but it is a different version of their reality. And we're really trying to figure out, what those versions of reality have in common. So I might at different points reflect on different examples of studies that we're doing in the psych department at the moment, or that my students are doing. One of my students is at the moment investigating the experiences of psychologists who have been in practice for about 4 or 5 years, but who are culturally are causa. So we are trying to figure out, how do new psychologists find their feet, get to a place where they're comfortable and confident in their professional life. And was there ever a clash for them, because much of the training can be in concepts and theories that come from Europe that maybe are not African as such. So that's one of the studies that we're doing at the moment. And so my student has done interviews with a few causa psychologists and said to them, what's it been like? How did you get to a place where you're comfortable and confident with what you're doing? And we are specifically looking at their experiences, their subjective realities. And then we're looking at the themes that emerge across these different participants. All right. So for them, more than one version of reality. And that's what we're after. We're actually wanting to know, what was it like for you? We're really interested in their subjectivity. We don't want them to be objective. We don't want them to look at what it should be. We want to know what it was like for them. Okay. In that way, we are really interested in qualitative analysis in context. in understanding the overall context within which someone functions. For example, in that study, the person who says, yes, I'm causa speaking, but I've got access to some resources. So that's made my life easier because I've been able to access different things, help, a mentor, extra supervision when I've needed it. That person will have a different experience than the person who says, sure, it was really hard in the beginning because I had no money, right? So then their context also feeds into their subjective experience. And so there's this interaction that forms between, we can't remove the person's reality, what they're saying, from the context they find themselves in. Okay, so when we analyze the data that comes from these kinds of processes, we're looking to create meaning. We're looking to extract patterns that are meaningful. And it is an iterative process. So it's back and forth, going from concrete data and what people say in a very concrete way to abstracting, to taking themes that represent something very abstract in terms of what they mean. All right, so that process of abstracting a meaning is more than just a summary, yeah? Right? We can summarize an interview according to research questions, but we're looking for the meaning within that interview. What are the words representing? Okay, so we'll look a little bit more on that as we go along. Qualitative analysis can feel messy because you can get overwhelmed by data. There's loads of words and you're needing to sift through it to be able to find the meaning, to find a way to make sense of it. All right. So how do we do that? Often we're either looking for patterns that emerge, we're looking for interaction within the data, or we're looking at stories. All right, with the example that I used, interviewing psychologists, they are going to tell stories about what their experience was like. Right? We can also then look at the patterns that emerge across those stories. And we might look at how different variables interact within the stories, such as things like, I had to be autonomous, I had to be independent, but I was also a little uncertain. How did that need to be autonomous interact with the uncertainty? So in some ways, you can use all three as frameworks at the same time. But in other ways, you can also choose to just do your analysis from one framework. Like I'm looking at the stories that people tell about this. Okay, so what is really important here is the word subjectivity. Right? We operate in a subjective, interpreted world. In qualitative analysis, there is no objective, right? There is no one truth that we are getting to. Everything is subjective from your perspective, all right? From the participant's perspective. But what's really important for you as a researcher is that you also have a perspective. And you want to ensure that your perspective doesn't slant your data too much. if my student goes into her studies saying, yo, you know, in the beginning when you become a psychologist, it's really hard, eh? Everything feels intimidating, right? If she does that, she may very well be looking for that theme in her data. So she's got to be very careful that if a level of uncertainty and growing confidence is something that her data tells her, then that's okay. Then that emerges from the interview that she is reading. But now it becomes difficult because she's got to be very aware what's happening inside of her so that it isn't projected onto her data, right? So the more she is aware of her own thoughts, her own biases, the better, right? First position for that is acknowledging that we are not neutral, right? We are not just computer processors that read through data and pick out the themes. We can't be neutral. And we are the ones that are giving coherence to data, that are piecing it together in a way that is meaningful. All right. And we've got to then acknowledge our subjectivity and at the same time try to bracket away that we have too much influence in channeling data in a particular direction. So that might sound a little bit ambiguous initially, because I think it is a strange tension where you are subjective. You are piecing something together. At the same time, you don't want to push your agenda onto data. Okay. The crux of it, though, is analysis in qualitative analysis happens because of our subjectivity and not despite it. Right? It really depends on your position towards your data. But there are different analysis, different ways of analyzing data that look at the data, at the researcher's subjectivity more and more strongly. All right. For example, in IPA, in that analysis, you look at what does the participant say, and then you actually look as a form of data, what is my own reaction to what I'm hearing, to what I'm seeing, all right? And your reaction to that forms another layer of your data. Whereas if you're doing a plain thematic analysis, you aren't necessarily coding your own response, depending on how much depth you're going to go into. Okay, so how do I navigate this space where I know I'm subjective and I know I don't want to push the data into a direction too much, but I'm using my subjectivity, my way of thinking to make sense, all right? Firstly, we are guided by our methodologies, by our research question, all right? We ask questions of the participants, and then we ask questions of the data, right? In my student study, she's asking her participants, what has it been like finding your feet in private practice? All right. Then she'll have an interview worth of data that's been transcribed. And then she's asking that same question of the data. What is this person's data saying about what it's been like? All right. She might be talking about her family here. She might be talking about other interest areas that would have been nice. She might have been talking about how she wishes she had more of a business background. She might go off in all different directions, but ultimately the question of the data is, what has it been like finding your feet in private practice? And we keep going back to that question. We're guided by the question in terms of what we are looking at, what we're looking for in the data. And that also grounds us a little bit. It helps us to keep a focus, which is going to also help counter some of the extreme subjectivity that could arise if we're not cautious about it. Okay, this is bringing us to concepts around ontology and epistemology. I don't think you guys have covered that yet, eh? Okay. This is quite important because it runs in the background in a data analysis. All right. It is, how do you believe that reality works? Right. This is, can my participants have two completely different experiences of the same thing? Is that really okay? All right. How do I understand knowledge to be created? Is knowledge something that is out there and I've just got to go and find it? Or is knowledge something that I create, that I piece together as it emerges from my data? All right. I piece it together in a particular way. Somebody else might sit with that transcript of an interview and they look at it with different eyes. They might piece it together in a slightly different way. The chances are good that it's not going to be like I'm creating apples and this person is creating a pumpkin. All right. The chances are we're still going to be in a similar realm of what we create in our data. But because of our subjectivity, somebody might create a slightly different understanding of what they see in data. All right. And that is underpinned. I accept that because it is underpinned by the idea that we're not just after that maths formula, that truth behind the data. It's something that is being created. Right. That orientation will filter into your research question, will filter into the way in which your data is generated. Right. What does that mean? It means that a question such as, what has it been like for you when you find yourself, when you find your feet in private practice, right? That question is designed to create, to get the person to show the reality, to show their subjective experience. And with the knowledge that people will present different, slightly different subjective experiences. The more we move away from numbers and positivistic way of doing research, the more we get into complexity, the more we get into people having different experiences and different nuances within those experiences. Okay. The more complex we become, the more we go from just describing the reality of others to looking at different variables and different interactions within that reality. Okay. For example, power dynamics, right? When we really get into complex analysis, we might look for different discourses, we might look for different power dynamics that emerge from data, right? Then the person isn't just saying, sure, I was really uncertain in the beginning, hey, but as I built up experience, I built my confidence. That's really an experiential orientation. But when we look at more depth dynamic of what is it that they're reflecting that held their confidence back, or that really made their confidence grow? Did they have a mentor, a guide? Did they have anything else that caused a power dynamic or caused some kind of shift in their experience? Then we're looking at what they're presenting in a far more complex way. And we're going in with a far more of a critical orientation to the data they're presenting. Okay, so we know that the data is going to be very much linked to what research question you're asking, what this research approach is. Are you looking for an experiential, just describing somebody's reality? Are you looking to analyze it in a more depth manner? Are you doing an exploratory descriptive study? Are you doing an IPA study? But you're going to be choosing a form of analysis. So when you are doing an analysis, you're not just doing content analysis or thematic analysis or IPA. You're doing somebody's version of it, all right? So you might choose Miles and Huberman. You might choose Braun and Clark, right? But you're going to look for authors that have a particular version of an analysis. I think arguably one of the most well-known forms of analysis for qualitative analysis is the one put forward by Braun and Clark. And it's also one of the most flexible forms of data analysis that isn't too influenced by your ontology and your epistemology, right? It's very flexible for a range of forms of data analysis. I put it up there just so that you could see what their analysis looks like. Okay, Braun and Clark says they've got 6 steps in a data analysis, and they say, first you read your data, you familiarize yourself with your data. Then you give codes, patterns, themes, and produce a report. Okay, we're going to look at that. But again, before we go into it, I just want to stress to you that this is a process of constructing, not discovering. All right? You're not trying to discover the truth. You're trying to construct an idea, a theme that emerges across, for example, across different interviews. It is a constructive process. Okay. Whichever form of data analysis you use, such as Braun and Clark, you're going to start off with a transcription of your data. I think a popular form of qualitative analysis is going to be something that comes from a semi-structured interview or some form of interview, right? Most of the time people will audio tape it. Sometimes they videotape it. And then there's going to be a process of transcribing it, right? And you type it up in a manner that
has everything down exactly. Every 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 pause, you would put that down so that when you're finished, that interview is exactly what happened. Right. I know with Braun and Clark, they actually insist that the researcher does their own transcribing. Not all of the methods of analysis insist on that. But Braun and Clark are saying that your analysis starts already from there. You're already building your ideas about what is coming out of this interview when you start to type it down on paper. Okay. Again, you're putting down the interview as it's happened. But as you start to analyze, you're not just creating a summary. All right. You're not just creating a summary of what emerged from each research question. You're trying to make sense. You're trying to make meaning, which is a deeper level than just a summary. Whatever research method you use, Braun and Clark, Miles and Huberman, something else, where it generally starts is coding. So you're going to read through your data and you're going to look at different little units, different aspects in the data as you go along, with the research question in mind. So the research question I gave you earlier, what is it like to start private practice? How did you find your feet in private practice, right? And you read the interview looking for little units, codes that pertain to that question. Now, you can either only code what is relevant to your research question. That's what I've been saying to this point. But there is also a form of analysis where you code absolutely everything, all right? But it's going to depend on your research question, all right? Sometimes people have a broader research question, so everything becomes relevant. At this point, you don't actually have themes yet. You have little units of meaning. Okay, I put this in because I thought it might be interesting for you to just see what a piece of data looks like. This is from an interview that my student did with this group. I'm just going to read a portion of it. I think it has become, okay, how strongly do you identify with your culture? I think it's become stronger over the years, particularly because of moving from Gauteng to Eastern Cape. Firstly, my tongue was not as strong as those that grew up there. So even the clicks were a bit of a challenge for me, my tone. So I used to get made fun of a lot because my words were not sounding as rigid as what a normal causa, typical causa should. So it was because I have memories of that. So I grew up there. Is also an enmeshment of religion and culture. It was a battle for me. It was, I won't lie. Okay. You can hear that the way the interview is how it is on paper is literally how the person was talking, and that they're going off in slight directions. So it makes sense to you that the person who's going to code this is going to keep that question at the back of their mind and really think around, first of all, how does the question, do you identify with your culture, fit into this broader understanding of how a causa individual finds their feet in private practice? And that's going to influence what it is we're coding for. All right. I think one of the obvious things that stands out for me is that the person was actually kind of went through an adjustment period, moving from Gauteng to the Eastern Cape, where they got teased about the way that they spoke. Right. Later on in the interview, it becomes evident that they connected more and more to their culture. And now as an adult, connect very strongly to culture. Right. So it's quite possible to just get overwhelmed by data. And when you are coding with a research question in mind, it actually makes it easier than coding absolutely everything, right? Because that research question is going to help you zone in on different bits. Then we might call it uncertainty. We might call it not normal or not typical. Whatever it is that is jumping out at us for that person in their response. Okay, so you might capture a word, brief phrase, an essence of meaning. All right. And you're going to literally reduce your data to chunks of meaning. You can call these codes, you can use different ways to call them. You can use descriptor words. You can use their exact wording verbatim. Emotions, values, evaluation. You can look at relationships in those codes. You can use words that either come from the data or words that you have generated, meaning that you have made. So however you want to code, you develop a system for you that you use to code. And then I've seen people literally do this, where they have a wall of codes and they start moving codes together. And then they'll literally say, okay, I'm moving this one now over here because it fits there better. Right? I've seen people who specifically use Post-its because it's so easy to move things around. Right? And because this whole process of creating meaning, it's like it's an active thing, it's alive. And you're literally trying to piece together what your data is saying. Okay, so you start to cluster codes together that seem related to each other, until eventually it starts to settle into kind of nodes and then themes. Okay, so themes essentially are going to be patterns of meaning across your data set. It's going to capture something important, something interesting about the data in relation to your research question. So essentially, visibly, what it might look like is that, right? Lots of data which emerges into codes, categories, and themes. And then sometimes people have maybe, let's say they settle on 4 themes, but some of their themes will have sub-themes, right? 2 or 3 big things that emerged within that theme as important. Okay, so questions to ask of yourself when you're creating those themes and sub-themes. Do the themes make sense in relation to what I'm asking? Does the data support this? Am I trying to fit too much in a theme? Do my themes overlap? Sometimes if there's too much overlap, we'll merge them into one theme. Are there themes within my themes? Then I might want to create 2 sub-themes. Are there other themes in the data that I've missed? Okay. In order to create this, it's just important to go about it in a flexible and iterative manner. So you go back and forth as you try and create meaning. And it's just important to stay true to your data. Let the data guide you in terms of what it wants to tell you. Maintain your reflexivity and record your decisions. Reflexivity is when you're thinking about how you are impacting your data, what the data is doing to you. All right? You might say, but I really think this particular theme is important. But if I think about it very reflexively and very carefully, the data isn't saying it's important. All right. So then we need to let the data guide us rather than what we believe should be coming from the data. Okay, so the whole process, the overall process that you're going through is to construct possible answers to your research question, right? And essentially you're wanting to tell a story to the reader. You do that by keeping your research questions in mind and by going through that process of data, codes, categories, sub-themes, themes. Okay, so I put an example of something from my own research that I did. My research study was on One Life, a guy by the name of Howard Hughes. And it was trying to understand his personality, and particularly narcissism within his personality. Right. And so I first looked at themes that came out from his childhood. So there we have the themes from his childhood. And then I looked at how they might have emerged in adulthood. And the list of themes on the right are the ones that emerged from his adulthood. So here, there were themes around what his generalized interests were, how we saw entitlement and grandiosity already when he was little, that smothering control and a lack of independence was particularly from his mom, how he had poor health and illness when he was little, what his interaction style was like, and generally what his parents were like. Later, as an adult, there were themes around being over-involved and hardworking, detailed in particular, again, grandiose, controlling, manipulative and entitled, rebellious and vengeful, lacked guilt, atypical sexual behavior, how he would reconstruct reality. He'd shift importance in relationships. So at some point, somebody's important and then they're not. Very distrustful and paranoid in his interactions, very much black and white thinking, health difficulties, obsessive compulsive issues, switching, Jekyll and Hyde, and aggressive and reckless. All right. That emerged over reading lots and lots of data that describe what this man's life was like. Right. And then the table summarizes those themes that emerged. And then in my findings chapter, I went into each of them and explained them. Right. So ultimately what you're going to do is take your themes, and it's useful to put them together in a table format, although you don't have to, but at least depict them together in some way so that the reader can see what the themes were that emerged from your work. And then you would describe them and have some kind of a discussion on them. Okay. So that is the first, I think I'm just on time, right? Yes. Are there any questions for me around data analysis of qualitative data? I want to see participants. Don't see anyone on the participant list with a question. No questions? Okay. Right.
Then you're actually on time. Thank you so much. I wonder whether students need a stretch before your next and whether you need to.
I'm okay.
Are you good?
Just going to open my water, I think.
Okay. Then if they don't need a stretch, then we can go for the last session.
I suspect the last session is going to be a little bit shorter.
Thank you, Doctor. So that will be on trustworthiness in qualitative research.
Mhm. Okay, I think I've just lost this somehow. Hold on one sec. I think Mr. Technical person, you can just, I've done something that is not. Thank you. It's just. Here we go. Thank you. Oh, thought it was. There we go. Thank you. Okay, so now we get to data trustworthiness. Because qualitative data analysis can be such a subjective process, this idea of piecing together meaning, of constructing a meaning, it's really important that we do this in an accountable manner. So there are principles that we adhere to that are going to enhance data trustworthiness, right? Because there is such a concern around bias and around subjectivity, they are the principles that are running in the back of our minds that we use when engaging with data that are going to increase the level of confidence that we have when we look at our data, that we can trust this data, right? And quantitative analysis, we would talk about reliability and validity. These are similar kinds of principles, but they have their qualitative names and descriptions and way of working within a qualitative analysis. So it's credibility, transferability, dependability, and confirmability. Okay, so credibility. The question here is whether the findings make sense, are believable, are accurate. Do they answer the identified question? If they're off topic, if they don't give an understanding, if they don't really relate to what you're doing, they're tangential, then they aren't useful anymore. Right, so we need to find ways to ensure that our findings make sense and that they're answering the research question. So techniques that are recommended for this is consulting relevant published data. I think often when we've researched in an area and we have themes that emerge, it's interesting when we look at literature that is in the same area, because we will then often have the understanding that our themes are either also emerging in other research, so it's like a confirming thing, or it becomes a point of interest to note that these three themes, they've already been found, but none of the other research is talking about this theme, right? Is it off topic, or is it just a new understanding, a new answer to the research question? So positioning yourself in other published work can be useful. Then we have prolonged engagement with the data. Now, on some levels, I always think that this sounds like such an obvious thing, but it's an important thing at the same time. When you think about that portion of the interview that I read to you, we can't just draw a conclusion now. You usually sit with a paragraph, with an answer, with a page, and you reread it, and you read it a good few times. You read your whole interview a couple of times before you even start really coding very much. And it's the idea that I'm not going to just make snap decisions about what this data is saying. I'm going to sit with it. I'm going to really engage with this data and try and understand it from different perspectives. That's the alternative explanations. All right. So if I can give you an example from the Howard Hughes research, right? Howard Hughes got involved with these really big projects, right? And some of you might know about this. For some of you, it might be new. He built the world's biggest plane. They gave the plane a nickname. It was called the Spruce Goose. And it's still in a museum in America somewhere. And it was built during the course of World War II. And the idea was that he was going to transport troops into the war. But he couldn't build a plane that was just a little bit smaller and more maneuverable. He had to build the biggest plane. And then the world ended. The war ended. And he still had not finished his plane. But he couldn't stop because he had to finish his plane. So now how do I generate different ways of understanding what was motivating this guy to keep going on this plane when it was costing him a whole lot of money? He was getting some very bad press from people saying they've given you money to you and you're still not finished. And what's the point now? How come he kept going? All right. One of the possible explanations could be pride. One of them could be work ethic, because he started something and he's going to see it through. One of them could be his narcissism, that he was determined to be the guy who built the biggest plane in the world, right? So it's really important that we not just settle on narcissism, but that we try and understand different ways of interpreting the data. And to do that, you've got to sit with your data. You've got to keep rereading and rereading, and then think it through. What could be different explanations for this finding, for this piece of data? Triangulation of data is a very useful thing if your project is of such a nature that allows you to triangulate. For example, you might have interviews with people seeking help at a hospital as well as the nursing staff. You can triangulate that data and come up with different perspectives, right? You might triangulate data where you are using different sources and trying to see if they're saying the same thing. Triangulation of data is a way to verify. And it's very useful. I know with my study, there were something like 8 or 9 sources there. And the colors are how they were all trying, I was trying to triangulate and see that they say the same thing. All right. So 3 different sources that all talk about how he stopped carrying cash around with him. He was the richest man in the world, and he'd get everybody else to pay because he was too paranoid to keep money in his pocket. It was interesting. Right. And 3 different sources spoke about that. Right. So it helps to confirm, yes, I really can rely on that piece of information. It did happen. Okay. Transferability is an issue in qualitative research because we don't have those huge samples that are very diverse that we can take a finding and say, yes, this is what it's like for everybody, right? We usually have small samples. They tend to be more homogeneous. And it means that we can't draw conclusions that are true for everyone. So even if they did a study on, I don't know, psychology students at this university, we could still only really say something about psychology students at this university. We don't know that the finding is true for psychology students in America. So, yeah. How do we then work with data in a way that we ensure transferability, or at least enhance the potential for transferability? So the first thing that we need to do is provide rich descriptions within our work, both in the methodology and in really richly describing our data, the context around our data. Because when you provide a really rich description, for example, of what the psychology students are experiencing at our university, then somebody from a different university can read it and say, you know, this has similarities to what's happening here by us. And they can only draw that conclusion themselves if you've given them enough information. So rich descriptions become very important because then the reader is in charge of transferability to their context. There is a possibility that you could be more purposeful in your sampling and sample for more diversity. Although I'm skeptical about this one because in qualitative research, our samples still don't get very big. And so your generalizability is still going to be very limited. Some studies allow you analytic generalization. So with Howard Hughes, we took a theory, a psychology theory, and we put it onto his life to try and understand him and say, does he fit the theory on narcissism? All right. And basically what it means is you end up generalizing to the theory. All right. And understanding the interaction of the data on the person's life and the theory that you're using. And so we draw conclusions based on the theory. Right? The theory says this and this should happen. And yes, look, it did happen. All right. And then reflexivity is really important. Being transparent about your perspective. Right? So there is space in qualitative research to really acknowledge why it is you're doing a particular study. What is it that draws you towards it? What do you want to understand with it? All right. So I have a student who's also doing a study on an individual, on a serial killer. And she says she grew up in an area where there was a lot of domestic violence. And she says, yeah, for sure, it's completely different things. This is a serial killer. Domestic violence is also a really important issue, but it's different. What she's saying is, how is it that somebody can treat people the way they want to, can treat them like objects? All right. And that is what she saw in her experience in her community of gender-based violence, that people were being treated as objects. And she says, so this is another person, yeah, completely different context, but he was treating people like objects. So she's going to understand what it is about him that allowed him to treat people like objects. She does wonder, although the contexts are completely different, whether any of the principles would be applied to different contexts. Does that make sense? I don't know whether any of the principles will be the same because the issues are different. The issues are very different. But it's going to be interesting to see what allowed one person to treat someone as an object, to treat women as objects really badly in a particular context, to see what those principles were that emerged, and to see if they have any relevance to other contexts. Right. She is quite open about her subjectivity, and she's wanting to understand a process of how people are treated as objects. And that's her reflexivity that is emerging. Okay, then we have something called dependability. How consistent, stable, and replicable are the findings? Can you do the study again and achieve the same results? Now, in this kind of study where you're surrounded by so much information, that can be very difficult. Like somebody else reads the same information and they see something different in it. All right. So the degree to which a research is repeatable is not often excessive. But there are things that we can at least do to ensure being transparent, right? And so that if somebody really wanted to go and repeat what we did, they could. So we could be consistent in our methods. So if we say we're going to do a semi-structured interview, we do a semi-structured interview and we do it in the order of the questions, in the way that we said we were going to do it. We could, again, triangulate our data to ensure that the points of data that we're working with are reliable. We could do an audit trail, which is to provide very detailed records of what we did and decisions that we made along the way. Then we could do something which is called member checking, which is when I've done a semi-structured interview and full interview with someone. And later, when I've got my results, I go back to them and I go, is this what you meant? Does this describe what you were saying? And then we could also do a peer review, which is to talk to peers for them to evaluate the quality of our data collection and analysis, and they give us feedback regarding what we're doing and how we're thinking about things. Right. So those are all ways in which we enhance the dependability of what we're doing. And then finally, we have confirmability, which is that idea of us shaping the data, where we don't want to shape the data to such a subjective degree. So we've got to be very vigilant of defining our constructs and staying true to the constructs that we define. So if I'm researching narcissism, I, in my research, build in a very clear understanding of what narcissism is. And when I talk about narcissism, when I look for narcissism in the data, that I stay true to the definition and the way I've thought and defined narcissism. Okay, again, an audit trail and data triangulation. They are useful ways in which I keep my, I keep avoiding a biased position, right? I explain exactly what I've done, and I triangulate my data so that I can really rely on it. Okay, member checking, we spoke about. Peer debriefing is the consultation with colleagues, and then reflexivity. Now, it really depends on what your study is on. But one of the popular ways in which we would work with reflexivity in psychology is through a research diary. So I think I have it on the next one. I'm going to just give you an example. This is something from my treatise. So this is the third week that I'm seriously writing my proposal, and I've noticed a change in my attitude towards Howard Hughes already. Before, I thought he was arrogant and I was appalled by his audacity. Somewhere I began to pity him and I found him almost pathetic. All right. So what I found interesting is that even at the early stages of my research, we would call it a transference, but my attitude towards him shifted. And it shifted back and forth a couple of times during the project. So the question becomes, why put that down on paper? Right? Because when I look at the data on his life, I am affected. My eyes look at that data differently if I pity him versus if, if I think he is arrogant. When I pity him, I might engage my empathy more. All right. When I think he's arrogant, I might be harder on him. So it can influence the way in which I'm looking at the data. And by putting it down in a research diary, I'm trying to track my thoughts and feelings about him so that I can bracket it away. All right. And that can be a very useful technique if you do it. But don't say you're going to do it and then hurriedly do research entries at the end, because then it hasn't helped. I have had students try to do that before. So that's my last point. Say what you do, what you say you're going to do, right? Know that when you're writing your proposal and you're putting this stuff down, you're literally putting together a pattern of your work. This is the process that I'm going to follow. And if a research diary is something that you choose to do, then remember, you got to go at least every few months and at least write an entry. Because otherwise, when you get to the end and you haven't done it, you can't remember what you thought about the person right at the beginning of the project. Then you've got to take it out of the methods that you used to enhance reflexivity in your work. Okay, so if we're going to summarize, I'm going to go back to that list over here. The four principles that we work on with data trustworthiness, they share methods. All right. Triangulation comes up a lot. Reflexivity comes up a lot. Thick descriptions, creating an audit trail, that comes up a lot. So these are all principles that you can really use to enhance your ability to trust your data and also to trust yourself within the process, where you're really describing what you're doing, you keep track of what you're doing, you are thinking about how you are influencing your data on a fairly regular basis. You triangulate your sources where you can, so that that triangulation confirms the data that you're using. And these are all processes that ultimately are going to allow you to bracket your bias away and be able to trust your data more deeply. Okay. I did promise you guys that the second session was probably going to be a little bit shorter. So that really is what I needed to say on data trustworthiness. Is there anyone with questions? Yes.
How honest would you say that you need to be with your reflexivity? Do you have to be like completely transparent? Because I think a lot of us, when it comes to research, we all have reasons why we want to research, what we want to research. So yeah, just kind of advice on how honest you need to be.
Okay. I do think there's a line. I was interested in narcissism because of having a family member that's narcissistic, but I didn't put that in my PhD. All right, because for me, it felt just a little bit too exposing. And I guess I was also worried that the examiner ultimately would see me as biased. So I also didn't want to over reveal and then create a bias in the other direction almost. All right. So I do think that there is a line, and you put down what you're comfortable with without overexposing yourself. But there is also a way in which you can say things then that allow you to say it without exposing. So you can talk about having had experiences with narcissism in a broader life setting, which made you interested. You know, something that softens it, or you could just talk about narcissism is very topical at the moment, and the debate out there in the media is me interested. It really depends on how much you want to reveal. That would go towards your positioning as a researcher. In qualitative research, we would usually put in a small section that says, this is why I'm doing this study. And that kind of thing would go in there. Reflexivity in terms of your data, it might come in, for example, in having had experiences with people who are narcissistic and then empathizing with what is coming out in the data. If that's the case, I would still write it down in my research diary. But when I'm doing my write-up and I put you don't put the whole diary in your actual write-up, you put a little excerpts out. I would take the excerpts that aren't so revealing. So you're still using the diary as the mechanism for what it's meant for, but you are still in charge ultimately in what you're going to put in a publishable form. Okay. Anyone else? Thanks for the question. That's a good question. Is there anyone online? I see a hand. Please go ahead.
Okay, thank you, Doc. Your presentation has built a lot of interest in myself.
Oh, good. I'm glad to hear that.
Yes. Doc, like my question is not specifically on your data collection and so on. However, it goes straight to your experience. Like how challenging it was to identify a narcissistic person, because as far as I understand, those people have double mask, of which one they put in the public is a fake one. The real one is one that is that they put like behind doors, because my understanding is that those people behind doors, they don't behave the same in public. They are lions behind dogs, but in the public it's not easy to identify them.
No.
So how
I hear
challenging
you.
it was to identify them. Thank you.
Well, what happened for me was that I needed to find someone there where there was a lot written about them, because it was a desktop study, meaning I read all the as many sources as I could written about his life. So I created a short list of people that I thought might be narcissistic. And you're saying, how did I know? Because it can be quite deceptive.
Yes.
Yeah. I have been in psychology for a while, and have studied a little bit of narcissism beforehand. So I think I had an advantage in that I knew a little bit about what to look for.
Okay.
And when I started to read about this man's life, it really became quite obvious in the life stories that he thought a whole lot about himself. And that is not the only feature of narcissism, but that is one of the common features that sometimes emerges, is a very strong opinion about the self. When you start to explore life experiences, the life experiences don't seem to back up the strong opinion. So that's what I saw in the stories that they were telling about his life. So that's why I knew that this guy probably was narcissistic. And then as I read, that got confirmed more. So that disconnect between somebody almost selling themselves as a superstar, but there isn't complete amount of evidence, that the disconnect there was what gave it away for this particular person. Don't know if that helps to answer your question.
Yes, it's quite clear though. It's quite clear.
Okay.
Thank you for that.
Sure. Anyone else? All right. Well, then I thank you for your attention and your time, and good luck.
Thank you very much. Well, we appreciate all the input and the time you set aside to be with us. I think what we will do, with your permission, we will get Prof. Malariedi to come and do the closure and then have lunch for the benefit of people who's online. Is that correct? Is there another question? Sorry, there's 2 more questions for you, Doc, it seems. Okay, we're just checking with Bertha.
Okay.
Who's there? I don't see any hands. That's what. On the chat. Oh, on the chat.
On the
okay.
chat. Hold on one sec. Let's just have a look. What am I missing here? Chat. Oh, in terms of the themes, what happens when you find a little dot to support the theme or find ways to modify a theme? Is that the question here? Okay, so it really depends on as sometimes it is possible to get a theme that you know has emerged in other data. Like you've read in a particular area, you know that a particular theme should be emerging from your participants, and it doesn't, or it emerges very lightly. I have had a student include that light theme in their findings before. But then they've acknowledged that. They've said only one participant spoke about this. I made a decision to include it anyway. And this is why. So if you feel like you're going to exclude something because there isn't enough data for it, then you definitely can do that, because that's not what's emerging from your data pool. If you choose to include something because one or two people said it, although it wasn't one of the biggest themes, but you've got a reason for including it, then I would own that. All right. Then you can choose to still include it, but then be very specific as to why. All right. Does that make sense?
Just checking now, are there any further questions before we excuse Doctor? Is that it?
Okay, good. Thanks, Samuel.
Thank you so much. Right, and then
Thank
we're going
you.
to call on Prof. Thank you so much again, Doc. Prof, we'll do the closure and then have lunch for the benefit of those who's online.
Wow, I'm sure all the delegates have been expecting this time to come. But honestly, without missing words, you've really been awesome. Thanks for your tenacity, your patience all through the program. And today, interestingly, we had a very fruitful session trying to launch us into the process of data analysis, both quantitative and qualitative. A big thank you to Dr. Sibanda, the biostatistician for the faculty, for doing justice to all those topics on how we can actually do the sampling strategy, and reliability, as well as validity. And taking it further, we had Dr. Alida, who actually now showed us how we can do the qualitative analysis, the trustworthiness. If you look at it, is similar to reliability, validity that is spoken about in the quantitative research. So it has really given us, a holistic idea. So whether you are doing quantitative, qualitative, or mixed method, you actually have the very good exposure that you need to launch further. And we do know that many of you are in different phases of your proposals or your program. So it's coming timely. And remember, it's not actually exhaustive. What you have learned today is just to show you what you could actually benefit from by interacting further with the faculty. So please do not be overwhelmed. We are not expecting you to comprehend everything that has been said, but is a way of letting you know the resources available that you can consult further to ensure that your program runs smoothly. So once again, a big thank you to our able chair for really allowing us to finish on time. You look at the time, you can see that really she's quite, can we just put our hands together for our chair for the entire day. She really managed the sessions very well. Thank you so much for your time. Really appreciate it. And all our online delegates, thank you so much for the interactions and the engagements. Really appreciate that. Please, before we go, I've just been reminded we need to take our photos. And please make sure at the end of the day, I mean, not today, but whenever it's uploaded, you'll be contacted. Zoom into the website and see how beautiful you've been looking from day one. So please, can we all gravitate to this section where we'll position ourselves? And our online delegates, do us a privilege. Could you please put on your camera so that we can see your beautiful, handsome faces? Please, can all the rest of the on-site delegates please come to the front where we then take our pics. And I would like to appreciate, as we just coming forward, our technical crew. Please, can we put our hands together for them? Thank you so much. Thank you so much. Thank you so much. And this also includes Matt, who is also capturing us nicely, making sure that we look better than we are actually present. So thank you so much. And it's really not be nice to end this session without saying a big thank you to Beth, the research directorate, for actually organizing this, and to Tracy. I'm not sure if Tracy is online today, but Tracy played just a pivotal role. She played a pivotal role in seeing to the success of this. So thank you so much, Tracy. It's much appreciated. And just before we take our pictures nicely, and just allow me join, please join us as well, the chair. I would like to drop the microphone, but I would like to say that the 2024 postgraduate orientation is now dissolved. Thank you so much.